Hi, everybody. Happy Monday. Thank you all for joining me today. Let me get over to my comment section so I can come and say hi to everybody who's, yes, hi, Cheekbones. I'm so glad you're here. Oh, you've got a new member. Well, Weena Marie Leah. Thank you so much for becoming a YouTube member. I think you're my first. I think you have the honor of being the first person. So if you want to throw me, sad pancreas emoji out there, I really appreciate it. Thank you so much. We look forward to having fun. I hope we do grow. Hi, I got my friend Eloise here. Thank you. Thank you, Eloise, for coming in today. I saw Bella's here. I'm going to get to you, young lady. You know I am. Thank you. If you are willing, either Bella or Eloise, I'll get Nightbot to drop in a link and you guys can join me on the stage. Okay. So just guys let me know how you feel about it. Okay. Because I'm not trying to be horrendous about anybody. Let me just say hi. Okay. Let me say hi to everyone. Hey, Kim, I'm glad you're joining us from Poland today. Come on in. Angela Glass is here. We always appreciate you. I'm telling you, hey, 3 hours a day seems excessive. Yeah, I think she does have something, but we're going to talk about, some of the potential things that could be occurring because, Chantel Marie is not somebody who is potentially seeing somebody other than Dr. Google about this. And so she's obviously been demonstrating, and we'll look back when she was in Canada, that she's concerned about things with her skin. And I can absolutely understand why. So I found some really interesting things because wound care was my jam as a nurse. As an RN, that was one of the things I prided myself on was my patient's wound care. And I know there are so many different types of skin disorders. And so I thought we could look at 12 that specifically go along with diabetes today. And then I wanted to bring up another potential issue that she could have going on. And unfortunately, unless you are familiar with kind of dealing with wounds and, we're going to talk about these things today. And I've just, the reason I started this platform was for health and social media and talking about topics that people will use for clickbait and may not have any actual knowledge other than their own anecdotal experiences and maybe limited medical exposure. Like I said, I have treated wounds for years, whether it's been with cellulitis, I'm very familiar with, and very attached to congestive heart failure, peripheral arterial disease. There's many things. So, Chantel jumped back real quick. So maybe she had been on already a course of antibiotics, but she wasn't eating like somebody who was on a course of antibiotics. Okay. The way she eats makes me think that there's no way this woman could be on antibiotics. How I know? Because I'm on 2 antibiotics currently for a skin infection. And I don't also want people to ever feel that their skin infections are about being dirty. Now, a lot of times they are, but there's a lot of other reasons why people get skin infections. And so to kind of alienate and potentially make people feel bad about stuff, because I have a skin infection. It's not healing easily. This is I don't know how many courses of antibiotics I've been on. Now I'm on 2. And it's still having a tough time healing. It can be very, a topic that can cause people distress. Skin infections aren't fun. Now, we know that Chantel's not a great person. And so I'm not trying to condone any of her behaviors or how she is or how she acts. But I don't want other people thinking that they're getting solid medical information either from Chantel or other people who are using her medical diagnoses in order to get clicks to the channels. And maybe they shouldn't wade too much into those topics and be more considerate and potentially just more just aware that the harm that can come from it. It's kind of bullying to people with skin infections. Anyway, hey, Bob, I'm so glad you're here. I'm so glad you're here. Let me get through everybody. Make sure I'm saying hi. Hey, Marabella, come on in, girl. Team Psych Ward here. Thank you, girl. I appreciate it. We got all 19 chins and counting. Come on in. Come on in. Miss Brooke is here. Miss Pat Ray here. Hey, girls. Make sure I'm trying to get everyone. Miss Mia Moo. Miss Dot is here. Am I getting everyone? Am I getting Miss Cheekbones? Our friend Cheekbones, our registered dietitian. I had someone put in my comments like, why are you talking about medical and health stuff? You know, why don't you just react? There's plenty of reaction channels, I promise you. I like I said, I'm not trying to specifically, hey Jamie, come on in. Will's Fire. Thanks for joining the team. We really appreciate it. We're gonna have fun. And I need to give some away. And I'm gonna figure that out. So don't you worry, guys. Hey, Oscar Trout, come on in. Come on in. Come on in. Am I getting everyone? We got Lily here. We got Bobby Patrick. Jamie here. No skin infection shaming here. Thank you, Jamie. Hi, everyone. Yeah, because I do get a lot of people who are student nurses who come to this channel, who are students of, other things. We obviously have pharmacists and other folks in the chat. And so I'm interested because Bella has, her, protocols coming here from the US. Eloise has her protocols coming from the UK. It's always interesting to compare. I've seen what's happened, obviously, on the floor. I've had to manage patients with like active dementia and cellulitis and broken wrists and I mean the types, PICC lines, IV antibiotics. You don't want to get to that point. Oh yeah, absolutely. You're a nurse aide. Will you come on in? I know you deal with more wounds than anybody else. Those aides, they deal with a lot of wounds, folks. They deal with a lot of wound, Eloise says, I've done some study around wound care and talking with our tissue viability nurses. I always go, yes, that's one thing. Obviously, doctors are the ones who are always going to diagnose and, put forward the treatment plan. But often these treatment plans are carried out by wound care nurses who specialize in managing these wounds. And they probably know more about getting a wound healed than anybody else. And I actually did work in a long-term care facility with people trying to get better from really bad necrosing wound infections in really bad areas of the body and areas where these people may not have noticed something happening. And it had led them to literally being hospitalized, IV antibiotics, and so forth for months. I'm talking months. I've seen people die from skin infections. I've cared for people with skin infections that they've passed away from because they've been so severe. I have worked with patients in radiation oncology. So I've had to educate patients on how to care for their skin while receiving radiation treatment, which can be especially harsh for women on the breast area where the skin is very, very delicate. On that chest area is very delicate, very, very delicate skin. And I have just a lot of experience with wounds, a lot too. So yeah, I went off there. Hey, first of all, there needs to be a culture of wounds and blood cultures, proper antibiotics. Absolutely. I will say, though, unfortunately, Bella, in practice, like in a long-term care, when you see someone they have those raging ones, I guess if they're not actually producing exudate at that time and they're just swelling, then it may be not possible to culture. So a lot of times I've seen, doctors probably give like the streptococca A antibiotic and the other. I think, yeah. And infection leading to amputation. Oh gosh, yes. Yeah, oh, Junebug. Yeah, you guys can hear Junebug in the background. Okay. So we can thank Chantel. Yes, thank you, Michelle. We can thank Chantel for this. Like I said, I'm not throwing anybody specifically under the bus. That's not why I'm here today. I just ask that, and this is just my channel is about health in social media commentary. And so it can involve content creators and people who react or also content creators. They may call themselves reactors, but they're content creators at the end of the day. And I think it's fun to use Chantel's medical issues or what she claims to be her medical issue because she probably has something going on, but she's not actually seeking correct medical care. I think a lot of it is coming from Dr. Google. I think she puts her symptoms into a web search and she basically diagnoses herself. And people would then say, oh, Stackish says, I've had a PIC line. It was a lot. The antibiotics ended up not working. So it was taken out 4 days later. You were switched over to oral Zyvox. Yeah. And IV antibiotics. Antibiotics are nothing to mess with. I can tell you, because I've been just forever on these things at the moment. And Eloise says it can take 48 hours to get sensitivities, and sometimes you need to get yes. If it's raging, oh my gosh. I had one gentleman, especially the congestive heart failure patients. I had one gentleman who decided that he was going to take his annual trip out to Vegas, and he was wheelchair bound, and he got the most raging cellulitis that you have ever seen because he was just dependent. I have seen some terrible cellulitis on patients who are often immobile and they're not doing any type of leg exercising at all. And then they're getting like other issues. I mean, just like people will scream from cellulitis. I've seen the worst on a lung cancer patient who wouldn't get out of his wheelchair. It was one of the most horrific things of cellulitis. And it was very difficult because he was getting brain mets for brain metastasis going on. It was affecting his ability to understand. Oh, it was wild. Yeah. Blood cultures are done often nowadays here. Oh, good. There's a lot of crud going on with different bugs. Well, that's good because, like I said, often on the heart hospital, we're so used to cellulitis, diabetics. I've just seen them give. I mean, I've had one where I had this poor lady with cellulitis, and she was with dementia, and she often would think she was 17. I would have to try to crush and hide antibiotics in a chocolate pudding because otherwise she may not take her meds. And so trying to get somebody in that and they couldn't get her to probably sit there and do IV antibiotics, and probably the infection was making it worse. Oh, yeah. Oh, wounds can go deep. Yes, wounds can go very deep. Wounds can go really deep. I have seen it take. I mean, I have seen things that make horror movies look like a day in the park. You know, the wounds that I have seen, one starting from a hair that got infected in a gluteal area on a gentleman. And obviously he didn't notice. It became infected. It became necrotic. And it literally took off the entire back. And I'm not trying to be gruesome, down to to his fibula tibula. You could see everything. Obviously he did not live. But he lived a long time like that with this huge infection. The whole leg was stripped off the back. Oh, wild. And I've seen I've seen where, patients have such necrotic wounds from esophageal cancers that you're seeing people's, you're seeing the bone, okay, like inside the neck. You're seeing, yeah, it's interesting, but covert administration is complicated. So much paperwork. Yeah. Anyway, many ER doctors are doing so many blood cultures. If any questions, I'm glad that we are. I think we did it, and I think probably post-pandemic, I think now we should be probably, especially, in a large country like the United States, there's a lot of movement of people. I would think that we probably are trying to get a little bit better because there are a lot more things. Hey, like I said, I can't shake this infection. I have. Oh, yeah. I think it was, there was an antibiotic. Oh, I wish I could remember the name now. We used to use it. We crush it up and just sprinkle it into the necrotic tissue to kind of help with the smell. If either of you pharmacists remember which antibiotic that, but we would crush it up. And specifically, it wasn't even to try to heal anything because that wasn't the point. It was literally to contain the smell from the tissue rotting around this man's neck. Hey, Mrs. Murta. I'm so glad. I'm so glad. Sarah says, from what she said, that infection got worse after the flight. And that's when she took antibiotics. I don't think it's related to her ER stint back in Canada. Okay, thank you, Sarah. Because she's been a couple of weeks back now in Kuwait. And I am kind of thinking, I mean, she's not very mobile in the plane. So it is possible that she could have gotten lower extremity edema, and it became her legs inflamed and infected. But I'm surprised. I guess she can't show any body parts now since she is a Muslim revert. So we have to respect that we are not her practitioners. And so there's no possibility of physical assessment. And she's not been reluctant to mention the area. So I want to think if it were the leg, she may have said something, but then maybe not because she wouldn't want people to connect it with her flying. So, I mean, there's different things. I'm wondering, I have a couple of propositions. I got a couple of propositions. Yes. Do you guys remember which is the name of that? Oh my gosh. Necrotizing fasciitis. Oh, yes. Yeah. Yep. That was the one I dealt with the gentleman who lost the back of his leg. The one where I had to sprinkle the antibiotic, that was due to esophageal cancer. And that had been because the patient was late, I think, getting treatment. Oh, it was bad. I don't even want to describe it because it's the middle of the day. And it's really bad. It's really horrific. Okay. I mean, we were trying. I promise you, you think C. diff smells bad? Go into a room with rotting tissue. You're putting coffee grounds in the room in little things to try to just absorb. You've got everything trying to mask the smells because it will waft everywhere. I'm thinking the folds of her skin too, Eloise, and you'll see I'll get to it because I'm going to go into the moisture associated skin damage realm and take a look at possibilities of that. And there's one in particular I'm going to be looking at specifically, which is intertrigonous dermatitis. And if you see, and we're going to see a picture, and if you see the picture to it, I think, you'll understand. Wookie says, this is much like the things I see being a vet tech. I can't imagine. Right. You can handle animals. See, I find it hard with the animals. Children would kill me. I can't do the children. I saw one horrific child abuse case and it made me want to kill the parents. Here we go. Thank you so much for the super. Okay, says, I believe it was an infected boil from chafing in her thigh or underarm. Please, love you. Well, I mean, we can talk about that and whether it's coming from a boil or from a different reason. Because, boils, there's so many things. I think certainly things can start to brew up. But I don't know if specifically like a boil. I'm going to show you some things that I think it is that go into the realm of, like I said, I have a really interesting doctor who explains very quickly. So this will be fast. I'm glad. I love hearing everybody with their thoughts. I love it. I'm gonna make sure I show everyone. Explaining 12 skin conditions that are specifically to diabetes, which I think would be a good place to start looking. And then I wanted to go over to this other thing just because of some of the products she was buying and the potential that this could be what's going on. And then I had, if we have enough time, I had a really interesting um, show from the Doctor's Radio that talked about skin microbiome and kind of it was very interesting because it linked it along with like dermatology and like gut health. It was very interesting. And so how she eats, how she lives, all of these things are going to be something that are going to affect obviously her um skin in a lot of ways, and diabetes really does affect it. So I think we've discussed how diet can affect the skin. Right, she should have. She should have watched that one. And I'm going to point out 12 skin conditions specifically. You get infected boils, painful? Yeah, they are. I know. I'm sorry to hear that. I'm sorry to hear that. We have Averine here. I'm an RN, but my specialties are aesthetics and fertility. I never enjoyed wound care, and I came in. Oh, well, thank you. I would have loved to have gotten into aesthetics. But boy, did I do wound care. It's one of those things. You either love it or you just can't do it. You know, you either are able to understand how important, it is. I promise you, when you've got to get that wound vac working correctly and not letting it like, I promise you, there are some challenging wounds that you can be working with. So yeah, I've packed wounds on for wound vacs and all sorts of things. I've had a myriad of wound experience. Okay, make sure I'm getting everyone here. All right, so let me just bring up the first thing with Chantel, just to bring in Chantel. I know people just love to see her, so I want to make sure I include her. And if you do have a chance to like this stream, I so appreciate it. Obviously, we're having conversations around medical topics. I don't think people probably know, but I just want to make sure that people know I am a licensed registered nurse here in the United States with a Bachelor of Science in Nursing. I have also well over a year of graduate studies, studying to be a nurse practitioner for acute care adult gerontology. I'm kind of taking a little break from my studies at the moment because I got this skin infection that's trying to heal. Yeah, we have a fantastic group here today. I'm so excited. Thank you guys. Thank you to all my new members, all the supers, all the great conversation. I know a lot of people come to this community just to be in the chat and to get an opportunity to chat with all these wonderful people. And so I just know medical grade maggots. Oh, yes. Oh, yeah. I promise you, I've had a really fascinating time this morning, just studying up again on all the different skin conditions. And I just kept thinking, was she mistaking moisture associated skin deterioration with cellulitis? And there's a specific one for a specific areas of the body between folds that can look very similar. But cellulitis is really very distinct. And so, oh yeah, the maggot therapies. Oh yeah. They will clean out a wound bed. They do leeches still as well, believe it or not. But yeah, they have where the wounds are so bad that they will try to actually introduce maggots, like specialized, they aren't just like going to a trash can and dragging out some maggots. And these little guys will eat up all the really, all the nasty tissue because that's what maggots like. They like dead tissue. So yeah, but it's a very absolute specific therapy. Hey, Patty, you really enjoy the chat, Melanie? Well, I'm so glad. Hi, come on in. Oh, well, that's an interesting one too, Patty. That's an interesting one. I was gonna maybe if we get a chance, maybe we'll take a peek-see at that one, Patty. Make sure you remind me. I'm gonna have to write that down. You we got 2 great pharmacists here, guys. I just want you to know, Eloise and Bella Natalia, both pharmacists. They're doctors, guys, okay? And, they are going to make sure that we stay, within, true ethical, and talking about these things because they can be really hard to treat, skin infections. So if Chantel does watch, I do hope that you didn't Dr. Google and get yourself like triple antibiotic ointment or cream or something like that off a shelf and treat yourself that way. Because also taking that excessive amount of zinc and magnesium, Eloise was kind enough to point out to me, really is not beneficial for her. And I think I said something about it anyway, not being part of the treatment plan. But it could do you more harm than good. Taking those excessive amounts of supplements like that actually do more harm to your kidneys. And so like I say, I understand the need for supplements because I have to supplement certain things, but it's under the provision of my physician. And so for her to say that, that would never had been prescribed by a physician to take excessive amounts of vitamin C. And you can take the scroll down. Squirrel jaw. Thank you, Eloise. Yeah. US government. USA has more. Oh, yeah. Oh, yeah. Oh, yes. You have to understand all the different there's so much in medicine. There's a lot involved in just trying to manage protocol, standards of protocol, things within your licensure, things within the hospital system itself, things that need to be reported. It can be very stressful. It's good to have lists. Yes, protocol. Oh my goodness, absolutely. Yes. Yeah, my aunt needed them cutting. Oh gosh, yes, gosh, they're so painful, Patty. Yes, I tell you, what's on my nose is not fun at the moment, and why I'm not on camera. I'll be honest. And I gotta walk around out in public with like a wound on my nose that I'm not allowed to cover up with makeup or put anything on. So it's right at the tip of my nose. I gotta walk around in a baseball hat too because it's 80 degrees here in Virginia Beach. It's getting hot. It's getting summer in the South. So Chantel is so misinformed. Because I think a lot of times what people will say is Salal's sister, who's a pharmacist, is giving her these medications. And I don't know what the protocol standards are in Kuwait. I would think they're fairly similar to other international protocols for management of medications. And to think that this pharmacist would risk her license just giving her meds from off of the thing, because she can't write the prescriptions for her. So they're suggesting a lot of times on these channels, his sister's just taking meds off a shelf and handing it to Chantel. And I just don't think that is absolute. I just don't think that his sister would risk her professional licensure for that because they do count these things. So how is she gonna? Is she always saying it's a waste? Angela Guy says you can't just give out meds. I know a 30-year-old diabetic. He had to have his leg chopped off from the knee down. Oh yeah, they start from the knee and then they'll take it right up to the thigh. They'll do a BKA and then an AKA. Below the knee, above the knee. I've seen some poor people go through that in one hospital stay. And they'll put you on more heparin and you will be more coagulated than you can imagine. It's just wild. So yeah, I've managed amputees. Most of it's from smoking, and they'll get peripheral, like PVDs, like peripheral venous disorders, particularly in the top of the femoral, and it will get just destroyed by smoking. And that is often too why we get amputees. That and diabetes, obviously. So, yeah. Yeah. You had a blister that wa yes. Oh, that's just and it's bad. You just can't give out meds. No, you can't, Renee. People really just think that because Salal's sister's a pharmacist, Chantel has an open door to every medication in Kuwait that she wants because his sister's just gonna get it for him. I just don't see that relationship between his sister or his family trying to do that. I just think that's just wild. Oh, had to adult a bit. Ugh, that's okay. We're adulting here. We're also talking about stuff. Your neighbor's an RN. Good for her. I got two RNs right in front of me and another one just down the way who used to be a connection of mine when she worked at a hospice and I did the inpatient hospice. She was at a company and we'd sometimes have their patients there for respite or potentially other issues. And so I actually worked kind of indirectly with one of the nurses in my neighborhood in a big city like Virginia Beach. Patty says, not all skin infections. Right, right, right. So one of the things with Chantel is we know that she's gaining weight, and one of the things that people who start to gain weight, the spaces where they're able to bathe become more limited, and bathing becomes more difficult. And it's difficult to reach, all the areas, get to all the folds, keep everything clean. And there are people who are big people who do try to stay clean. And so I wonder, and we'll see this Pennington Hall, like what they will do, as far as, like she had the wipes and the cornstarch. We're gonna look at that. Let's look at that real fast. Let me bring it up. Thank you, Angel of Glass, reminding everyone. Thank you. And thank you all of you who are here watching today, because I haven't even brought up a video yet. It's just been me blap blap. All right, let me share a screen here. This was the Pennington's haul. I know a lot of people have seen it, but what I thought we could do is just quickly take a look and see, the part where, let me make sure I'm smaller. There we go. She discusses all these things she buys because I think this is the first clue. And then we're going to listen a little bit about the different skin conditions for diabetes. We're going to go over to cellulitis, and then I'm going to show this other thing. So just be prepared if you do find things with wounds. There will be some pictures of wounds, okay? Not too bad, but the one I do show, there's nothing showing the bone. I'm not doing pressure ulcers today. You think something's been brewing since Thailand? Well, there's so many different things. That's why I first, unless you actually do a physical assessment of Chantel, it's probably going to be very difficult to know what's going on. She has had so many risk factors for so many different skin disorders. One, unfortunately, being overweight because of the skin folds and the moisture that can get trapped in between the folds of skin can lead to potentially more skin infections. Having type 2 diabetes, elevated blood sugars, not managing your diabetes or controlling your type 2 diabetes can also start to cause a number of, we're going to look at 12 skin infections just related to diabetes in a minute. It was a really good one. It's a really good thing. Oh, well, I'm so glad you got alive, Patricia. I'm so excited to hear everyone. Would it be easier to list out the things she is not at risk of at this point? Probably. Her diet, obviously, is not a complete profile and lacks a lot of the colors of the vegetable and fruit rainbow. And she seems to get her fruit from juice, which we've discussed is not a great source for a diabetic type 2 whose blood sugars are generally not controlled and not managed. The Thailand boil ever healed? That's the thing. Did it ever heal? Has it become more infected? We don't know. She could get problems on her feet that could cause her stuff, but she's talking about cellulitis. Cellulitis tends to cover a large area. Did the cellulitis, and so I don't know. We don't know because we don't know the location of the wound for one. And one thing with wounds is you do need to look at them. There's a lot that you learn about looking at the actual integrity of the skin. And there are so many different terms to explain how the wounds start to form over time. There's so many different types of ulcers and, to do with depths. And there's a lot involved with the wound bed, the skin, which stage of healing is it in when you're really dealing with very large wounds. It's actually could be anything else. Yeah, we don't know if she's got peripheral neuropathy because she is type 2 diabetic. It's very common for them to have their nerves get kind of destroyed, unfortunately. And causing because their blood sugars are not managed. So she's potentially has peripheral neuropathy. And because she has type 2 diabetes and because she's not well managed, her ability to heal from a wound is super delayed. You're going to have a really much more difficult time trying to get a patient who has type 2 diabetes often healed from wounds. And that's why these folks sadly end up with so many amputations and so forth, because the wounds become difficult to heal because the blood sugars are kind of acting against that healing process. Oh, don't you worry, cheek. So you, Miss Chantel, yeah, and she's probably gonna you just paid 12,000 to government care taxes. Good for you, Miss Patricia. I know that feeling. I paid well over 20 some $1,000 in taxes just last year to the US government. And that was probably federal. I don't even know if I've included state in that yet. State was probably like 7,000 or something. Oh, it was awful here. Oh, look at this. Hey, wellness homestead, Arwen of 42 years here. Oh, had horrible cellulitis from a wasp sting. That took 6 weeks of antibiotics, not overweight or from lack of cleanliness. Thank you. Right. A lot of people get cellulitis who are not overweight. There can be a lot of reasons because obviously she got an infection from the wasp sting, caused an infection. Cellulitis just means inflamed cells. Really. And so it can, and potentially she had then that break in the skin from the wasp. It introduced bacteria into the wound, and that bacteria then unfortunately led to the cellulitis. I'm so sorry you went through that. I'm so sorry. And it's weeks. It's weeks. 6 weeks. 6 weeks. That's why Chantel's saying that she's already cured of cellulitis. It's just, it's too quick. It's too fast. Okay. Let's see what she brought out here. And if anybody is a member of my channel, I don't know if I can see my emojis, but if you want to drop me a glucometer in the comment section, then please do drop me a glucometer. Well, is it MRSA or cellulitis? A couple of other things we're going to talk about. We're going to bring up a lot of things. God, I hope it's not MRSA. Coming from somebody who potentially her doctor thinks it could be pseudomonas or MRSA. And I promise you, I am not an unclean person. And even when my doctor even complimented me, it's cellulitis. We don't know unicorn blow. We don't know because we can't see. You don't have an option. I'm sorry. I know people are looking for stuff. I probably am not the person to ask at this moment. Mercer's rough. Oh God. Chantel. Oh, Delulu Ponte says Chantel wants the sympathies of being sick. Right. Well, unfortunately, if she really does have a skin condition and she's thinking either she still has it and she's just telling people she's fine. I just I would have felt that she would have vlogged something out about a clinic visit if she went somewhere to get antibiotics. And then she said antibiotic cream. And so I always feel with Chantal, she tries to do a lot of self-treating, that she really only uses doctors in emergency situations when her blood sugars are just so high she can barely function. And that's when she finally, and I think she was in Kuwait, she probably knew she needed to take medications for diabetes. I don't know if she'd been, because she'd been taking Ozempic, I understand, in Canada. So she's known for quite some time that she's had this condition. It wasn't new when she was initially. They did not put her on Ozempic for weight loss. That's Wegovy usually. They put her on Ozempic to manage her diabetes type 2. And so she's known for quite an extended period of time that she's been a type 2 diabetic. And she doesn't go to the dentist. She told everyone she hasn't seen a dentist in 10 years. And she also has, definitely Google stuff. No doctor is just going to have some woman walk in and say she has sciatica. And he'd be like, yeah, without any diagnostic test. It doesn't happen that way in medicine. I promise you. So she's really bad. Patty's Bella Wolf said, I had MRSA from delivering my first child. It was awful. Yes. I don't know which mine is because every time I go to see my doctor, whatever has already I don't want to be gross. It's not horrific, but I hope this round works. Luckily I'm hanging in there. I'm having some toast today and God, it tastes good. Your cellulitis turned into MRSA. Oh, you're right. It was the hospital in Canada. Yeah, I think she ate too much. She either had the norovirus, which she seemed to recover to, and I hope she wasn't going around spreading noro around Canada, or she got herself so high in her blood sugars that got her potentially into HHS or something, because the types of fluids she would be given would also treat hyperosmolality, I'm forgetting the other part, syndrome. HHS, I know the acronym, I know what I'm talking about. So this, because DKA, I mean, it can happen, but tends to be type 1s. You would need to see the labs to really know. But whatever went on, and if she was obviously losing fluids, when you're a type 2 diabetic, it's just going to be even worse. And they use fluids often to even kind of balance out the blood sugars. So it can be like, thank you, Pat. Hyperglycemic syndrome. Thank you. And that was never brought up by anybody. And so I stuck with what she said she had because I felt the message of that particular infectious disease was more important to highlight and illustrate at the time than trying to get into the nuances of DKA, diabetes, diabetic ketoacidosis, and hyperosmolar hyperglycemic syndrome, which is a potential that she could have gone into too. So unless you see labs and you can actually compare the two, you can't say what it is. You can conject and you can be like an armchair expert, but we don't ever see that information from Chantal. So it's always speculation. It's like a court case. We just speculate over here. Says that's why people seek wound care team. Wound care doctor don't let infections go. No, and plastic surgeons don't let them go either, thankfully. All right, let's get this thing up. Which I know we've seen this. Let's just do this real quick so we can get to see this fun thing with all these skin infections, guys.
Feminine wipes with aloe and vitamin D, hypoallergenic, pH balanced, dermatologist tested. Life brand is the shopper's brand. You get a double pack for $5 something. Oh, hey everybody. So you might want to get some of those. Well, and feminine wipes bees. My OB says they're not good. Well, whatever. So there's a lot of things not good. All right. Then you need some Johnson's powder. Aloe and vitamin E with cornstarch. The one with cornstarch. Yes. Okay. All right. So that's that. Now.
So she obviously was trying to control something at the time with wipes and cornstarch and looming. Yes, something was either reach a cooter. Well, I wonder if she's, because she finds it difficult to bathe, whether she's using wipes around her groin area where you can get folds in the skin. And you think when she's sitting, and she sits a lot, and she's always getting hot and sweaty and wears layers of clothes. Oh, Mrs. Muerta, thank you so much. That she's going to be getting some potentials. Mrs. Muerta says, I shudder at the thought. Thank you for the super chat, by the way. At the thought of her open wound in non-breathable poly and not cotton. Bet her knickers, we need a poll. I know. Oh, God. I will put a poll up for that, Mrs. Muerta. I'll get Nightbot out in a minute. Yeah. I don't know if she's wearing cotton undies. That's why they say to get the cotton undies so you can breathe. You know, it's better cotton, ladies. Much better to wear cotton. I think Chantel is a fan of a thong, which makes me really scared. Oh, thank you, Zeph Zaria, for the super sticker. You guys are being so kind today. I really appreciate it. Junebug appreciates it too. And her mom appreciates it very much as well. Since I am not able to work at the moment because of my nose infection. So that's why I really just didn't want to, kind of make people feel bad about it. The soap wasn't friendly either. Right. The Lush soaps, as lovely as they are, sometimes those ingredients, there's so many ingredients, and it actually can exacerbate a skin issue. And so probably she needs to be doing some really sensitive, like Cetaphil wash, or, something that is going to be, it's not going to make you smell like it just came out, but something like Cetaphil is probably a much more gentle body wash than using, your traditional ones. So for anybody who have skin issues, you live with Cetaphil. The shower. It's much better. It's much better. Yes, it's too many fragrances. Absolutely. It can be very irritating. It works on younger skin, okay? But it seems, as we get older, and there's such a link between our gut and our skin health, it's wild. That it's just, I think, fragrance limitation is probably good. And you're better than just spraying a little scent on or something than getting it really through the washes and all that. I have to say, I'm a Dove sensitive girl. I have found that I do like Dove sensitive. It's got a nice little smell to it. And I found that it's very good on my sensitive skin. So I do love me some Dove sensitive. I'm just going to say. Tree oil body washes. Yes, but they can be spicy. But definitely for skin with prone to acne and things, I understand that tree oil can be very healing and medicinal. So yeah, I definitely not. I definitely would say that. I'm not in healthcare, but it seems like it isn't wise to put heavily fragrant stuff on irritated skin. Yes, exactly. There's a really you can get so many good. There's another dermatological cream. Oh gosh, I can't remember the name. It's got like no fragrance to it. It's super thick. I used to get it at Target all the time. I'm sure people would know. Vanity cream. There we go. Oh, hey, how's Hannibal? Come on in. Come on in. Come on in. Yeah, Vanity cream. If anyone knows Vanity cream, you know it's like the bomb when it comes to being a, you know, very good non-fragrance, very thick moisturizer. There was a certain time when I had to live with Vanity cream. Lived with it. All right, let's. Hey, Hannibal, you're just in time to see us discuss different skin infections for diabetics because that's where we're at now in the show. All right, let me share this doctor. He's actually from the UK. His name is Dr. O'Donovan. He's got a lot of subs. He's got 257,000 subs, and he is going to explain, and we'll break it up, 12 skin conditions associated with diabetes. And he's a licensed doctor in the UK. So this professional licensure you see here is what I'm trying to get on my channel, saying from a licensed RN in the USA. Health professionals are licensed and how experts define health sources. So that's why I love to use so many health sources, because I would like to get this like Dr. Donovan has. Okay. So let's just take a look at these different skin conditions. Let's rule out anything involving diabetes, shall we?
In today's video, we're going to be covering 12 skin conditions which are associated with diabetes. Now, this is an important topic as it's estimated that 30% of patients with diabetes will experience a skin problem at some stage throughout the course of their disease. Now, in this video, there's going to be lots of clinical photographs, but before we get started, please can I request that if you haven't done so already, to subscribe to the channel for weekly medical education videos, and remember to like and share the video if you learned something new. Also, please remember,
this doctor has a very similar pair of glasses to mine almost, except I have a girly version. I got some trendy glasses like the cleary ones. They're purple, but I got the Coach pair. Anyway, he's got his figs on, and he's got his name on his thing. Oh, he's a man after my heart, because I've got my figs, and I put my name also on my shirt. We're so proud of ourselves. All right, but he explains this very well. Let him keep going.
that these skin signs aren't necessarily unique to diabetes.
Thank you, McKay,
there are other conditions which can cause these, and some can just occur in isolation without any clear underlying cause. So without further ado, let's get straight into the video and start off with the first associated skin sign, which is called acanthosis nigricans. Now, I've published a more detailed video on this already on the channel, so please check that out if you haven't done so already by clicking on the link up here. But essentially, the main symptom of acanthosis nigricans are patches of skin that are darker and thicker than usual. Some people describe these as feeling like velvety pieces of skin. They can appear anywhere on the body, but they are most common in the skin folds, so things such as the armpits, the neck, or the groin. And you can see that in these photos on screen. If you notice these skin changes, you should see a doctor. There can be other causes for acanthosis nigricans, such as being overweight, Cushing's disorder, and rarely stomach cancer. But again, your doctor will evaluate this further in relation to your own clinical picture. For more information,
and I'm going to let the doctor finish. So obviously we can never see a foodie, except, you know, because she even covers the neck now. So we don't see if she's getting the discoloration of the neck, the armpits, the joints of the arms anymore, because she's been quite covered up for the last couple of years. And I wonder if she was starting to get skin changes that, you know, made her a little bit more interested in being able to keep things covered and have that reason to always be covered. I just wonder how much she hides. All right. Let's keep going, doctor. So that's the first one.
On acanthosis nigricans, I've also included a link to the NHS website in the description box of this video, so please do check that.
And I wanted to thank you, MK, for becoming a member to the Life and Vibe community. I hope I have fun things planned. I am a planner. And so I am trying to hope that I can just get everything, as it should be. But thank you for becoming a member. All the members that have joined today, thank you guys so much. I do have a video. I just haven't voiced it yet, but maybe I'll show it at the end.
Out as
To
well.
say thank you.
Now, the second skin sign to be aware of are diabetic blisters. These are also known as bullosis, diabeticorum, or BD, or diabetic bulla, and you can see examples in the following photos. Now, these might pop up suddenly on your fingers, toes, hands, feet, and sometimes on the legs or forearms. They're usually white with no red around them. Now, the blisters might look scary, but they usually don't hurt, and typically they heal on their own in about 3 weeks. They could be a sign that you have diabetes or that your blood sugar levels aren't controlled. Again, if you're noticing that these are an issue, you should talk to your doctor or a health provider about your symptoms. That's because if you're a diabetic, you're more likely to be prone to skin infections. Now, the third skin sign is something called granuloma annulare.
Now, people said that she had a boil in Thailand. So, was this one of these ones that's more related to our diabetes? Because that's the second skin condition we've already looked at. So, it is potentially that she did a boil somewhere. We saw it was like around the foot, the ankle, and we do see her having a dragging leg. So, did that boil pop? And is it now caused her a skin infection? Is that why the leg is, you don't know? We don't know where it's located. She won't tell us. And so we're just going to try to eliminate. Maybe in the poll at the end too, we'll include not only the choice of her undies, but we'll look at, maybe we'll make a decision. It would be speculation and for education and information purposes only. Okay, keep going, doctor. He's very interesting.
Doctors aren't sure how this condition is linked to diabetes, but it is. They also don't know exactly what causes these tiny bumps around your ankles, hands, feet, or upper arms and elsewhere, but it may be a response to inflammation. Now, your doctor may try to treat it with creams or injections. However, often you don't need treatment if your symptoms are mild. And again, you're going to see a variety of photos on screen now demonstrating cases of granuloma annulare. Now, the fourth skin sign to be associated with diabetes that you need to be aware of is thickened skin. Again, your doctor might call this by its medical name, which is digital sclerosis. It can happen with both type 1 and type 2 diabetes, and the skin on the back of your hands or on your fingers or toes may be thick and waxy. Now, those patches may spread to your arms, upper back, and shoulders.
And, we've had times, it's hard to tell with the Chantel's filters. Sometimes what's going on with the hands. She certainly had times. There was one time right at the end of her leaving Kuwait where she was looking really pale and a little waxy, but not like this. All right, keep going. This is interesting.
In severe cases, you may have trouble moving your joints due to the thickened skin, and you might need physical therapy. Now, the best way to treat this thickened skin is to control your blood sugar, i.e. making sure that your underlying diabetes is well controlled. At number 5, these are known as shin spots. Again, the medical term, and it always has to be a different medical term, is diabetic dermopathy. Now, these can look like simple age spots, but they're not. So high blood sugar from diabetes typically damages small blood vessels. This is known as microvascular damage and causes these brownish patches to appear. Now, what they typically look like are roundish, rough spots, and they usually appear on the shins. Now, dermopathy is usually harmless and should fade away in around 18 months or so, but it can also last a long time. Now, moving on to the...
Now, obviously, this doctor is thinking the person with diabetes type 2 is managing their blood sugars and, keeping a check on these things. And somebody, Bella Wolf, just mentioned she saw that on Chantel. So we've already seen what is a diabetic ulcer, and that could have been the boil pretty easily. and it's around the foot area. And she said she had, at some point, she stubbed her toe. And I just, and I've always wondered about that toe.
The sixth issue, this is a rare but important complication of diabetes, and is something called necrobiosis lipodystia. And this is the sixth skin sign. Now, necrobiosis means degeneration and death. And here, small raised red spots on your skin slowly grow larger and shinier and sometimes turn yellow. Your skin may subsequently thin and split, and this causes sores called ulcers. Now, this can be very itchy and it can be very painful, but thankfully it's very rare. And it's estimated that only 1 in 300 people with diabetes ends up developing this. Now, it's hard to treat, but prescription medicines, injections, or lotions may help. And it's really important you see your doctor if you do notice this developing. Now, the seventh skin condition to be aware of are eruptive xanthomatosis. Now, uncontrolled diabetes.
That's scary. So most of these, except for the ones which should hopefully, disappear over time, probably with management of your diabetes type 2, most of these are really going to have to get a treatment plan. The boils, I mean, these are things you need to bring up to your practitioner, because if you're getting these things, then you're not getting good blood sugar control. And no, the solution isn't always to increase the meds. I know that's usually what happens, because that's, we don't want people sick. But it is much better to do, a little bit of nutrition and exercise in order to help mitigate the risk factors. To continue in the same lifestyle pattern, Chantel couldn't even walk the other day. She sat in a car and ate a quesadilla.
Can lead to breakouts of these pimply, waxy bumps on your hands, feet, arms, legs, and as well as your buttocks. Now, young males with type 1 diabetes are particularly likely to get these. The skin eruptions may be tender and itchy, but importantly, they're not contagious, i.e. they don't spread to other people. Now, it's important to talk about how to better control your blood sugar levels to prevent these from occurring in the first place. And this should help ease the symptoms of the bumps if you do have them. Now, more generally, diabetics are more prone to infections of the skin. This is both bacterial and fungal infections. So these skin conditions are numbers 8 and 9. So we're going to talk here about infections. And the reason that diabetics are more prone to skin infections is because high blood sugar can dry out your skin, can curb your immune system, and this raises your risk of skin infections, with Staphylococcus being the most common bacterial infection. For example, you might find that you have styes on your eyes, inflamed hair follicles, this is known as folliculitis, or infected nails. Again, you should talk to your doctor if your skin feels swollen, itchy, painful, or hot, especially if you know that you've got high blood sugar or diabetes. Similarly, fungi.
I think somebody we know has high blood sugars quite persistently. And we haven't seen her want to do a demonstrative blood sugar check in quite some time. And she certainly hasn't let us know what her recent A1C is, because she wouldn't want to. Because there's too many people who understand how terrible those numbers are and can actually discuss why they're terrible.
Love to hang out in the moist folds of skin. And that includes your armpits, under the breasts, around the nails, and the corners of the mouth. Now, you may have heard of something called athlete's foot on your feet, or something called jock itch around your genitals.
And I've noticed, and not to interrupt the doctor, Chantel's lips look like something going on sometimes. Like she's got some active infections that she definitely fights. So until she gets her blood sugar's not being controlled or managed, are just going to constantly prevent her from healing any of these wounds effectively. So for her to say that whatever she had, she's already done, she's great, it seems very unlikely. It just seems very unlikely. I think she has, she looks for sympathy. I think she releases little bits of information about long-term issues. This person isn't active because you don't feel good, and she just continues to sort of put herself at more risk by the way she eats and the way she has no activity. And she persistently talks about these glow ups and so forth. It's wild.
Or ringworm on your scalp. Candida albicans is the most common fungus that causes it. Your doctor can help to treat the infection and again tell you if it's a sign of uncontrolled diabetes. They'll do things like checking your blood sugars and taking your HbA1c levels. Now, coming in at number 10, we've got xanthelasma. Now, xanthelasma happens when your body collects extra cholesterol around your eyes. You might notice flat or slightly raised yellowish growths on or around the eyelid. And you can see examples of this on screen here. Now, the deposits aren't harmful or painful, but they could signal uncontrolled diabetes, high cholesterol, or other health problems. And often, high cholesterol and diabetes fall hand in hand with each other. So moving on now to discuss another really important...
And I've talked about that quite a lot with how you get a elevated, problems with your cholesterol levels when your blood sugars are not being controlled. So I hope she's not taking it lightly. I hope that she really does get proper medical care, because when she went to the hospital in Canada, she was in an emergency room. I don't think, unless you're going in there for the skin, they're not going to treat that. You go to the emergency room to be treated for the thing that you came in for. They're not going to look at all your other problems.
skin condition to be aware of with diabetes, and that's diabetic foot ulcers. And these have got an annual incidence of around 2 to 6%, and they can affect up to 34% of diabetic patients.
And we don't know when Chantel was still there, is she walking around all day with those tight pajamas on that she just bought? She then has like another like dress thing underneath it. Then she's got all this stuff around the face. I mean, she couldn't be doing more harm to her skin being able to breathe and heal than the way she is currently dressing. You also need to have really good shoes. And we know her footwear is supremely inappropriate
patients during their lifetime. So this is a super important problem to be aware of. Now, risk factors for developing a diabetic foot ulcer include things like type 2 diabetes. So type 2 diabetics tend to have foot ulcers more commonly than type 1, a duration of diabetes of at least 10 years, as well as poor diabetic control, being male, and a past history of a diabetic foot ulcer. Now, what do you need to look for? Well, these sores can start with nothing more.
I think for males, it's probably because most men are bigger and heavier. So they probably put more weight down on these feet. But, we got 500-pound Chantel here. So this is when they're going to talk about these different things with the foot. When you get the gangrene on here. This is fun. It's like medical school, everybody. But I think it's important to see what Chantel could potentially be getting to her in trouble, because we do see that foot act weird. And if she's not doing those foot checks, putting that mirror, like I said, you get a small mirror, you put at the end of something, you lie down and you look at the mirror and you see what's happening on your feet. It's very important for patients. Very important. And she spends a lot of time being dependent with her legs down. That to me alone is very worrying for her lower extremities. All right, keep going.
Than a small scrape if you've got diabetes, especially if it continues to rub in tight-fitting shoes. That's in part because of poor circulation that makes it harder for wounds to heal. And diabetes can also cause nerve damage, so you can't feel the damaged skin as well, so you don't know that the skin is damaged. So it's really important that you or someone else checks your foot for sores every day. And also, it's important to ask your doctor or podiatrist how to prevent them. Now, it's really important to try and manage these as soon as they're noticed, because there's a risk of secondary infection causing cellulitis or a spreading infection to the bone, which is known as osteomyelitis. Now, I am going to make a whole separate video on diabetic foot ulcers with a lot more detail in this video, but you just need to make sure that you're aware that foot ulcers are a really important issue to be vigilant about. Now, rounding up with number 12,
we may have to delve into the diabetic foot ulcer video with Dr. O'Donovan one day. Because he really explains things, I think, really nicely. Very simple explanations. and just highlighting. I mean, I would recommend anybody with type 2 diabetes to watch this video and be aware and be on the lookout always for these, even, you know, at all times, just to make sure, just be safe. Check the bottom of the feet, folks.
You have vitiligo. Now this is more common if you've got type 1 diabetes, but also people with type 2 can get it. It's not quite clear why vitiligo destroys cells that normally color your skin with pigment. Now you might notice
That's good to know, Bella Italia, not to interrupt this great doctor, but they're going to get ready to open up the pool here in my condos on May Day, whatever, Memorial Day weekend. So this year I think I'm going to go get myself a pool pass, enjoy this pool before I try to, because I'm trying to sell this place. Getting very popular, Virginia Beach. I think I can sell this place pretty easily.
a patchy skin of clearly different color. Usually affects the chest, stomach, or belly, as well as the back, but sometimes it can happen on the face as well. Now, vitiligo can be treated with medicated creams, UV light. It's important to use sunscreen to protect the affected skin patches if you do have vitiligo. Now, if you enjoyed this video and learned something new, please give it a thumbs up. If you've got any questions, leave them in the comments section. I do tend to reply to all of the comments. Just takes me a little bit of time to go through everything. And remember to hit the subscribe button if you've not done so already. That does bring us to the end of this video, where we've covered 12 important possible skin signs associated with diabetes. Now, there are many others, but this was just a brief overview of 12 important ones. For more information on all of these signs, please check out the links which I've included in the description box of the video. Once again, thank you very much for watching, and until next time, bye.
Well, thank you, doctor. That was very interesting. I'm going to do that. I'm going to make sure I give him a like over here. And I really do appreciate that there. Okay, so the next thing we're going to look at, let me stop sharing this screen. I wanted to bring up, obviously, very briefly, Chantel's explanation of her cellulitis, just real fast. Because, of course, she always says, has foot neuropathy type 2 and was walking with a staple in her big toe and didn't even feel it? Oh, my goodness. That's terrible. I'm so sorry. I hope your sister's doing better, because they can be very difficult to heal. I've had to work with people with plastic surgeons trying to put skin grafts onto diabetics' foot. So, you know, trying to keep them alive. Can you link him so I can follow? Yeah, if one of my mods wants to grab Dr. O'Donovan's link and drop it in my chat for me, I think somebody, it's his channel is called Dr. O'Donovan, just like that. I appreciate it. Yeah, he's really good. He's got his proper stuff going on too. I'm a little jealous. Okay. It takes a long time, I promise you. There's a lot of medical people, you know, trying to get into the YouTuberverse. Okay, I am gonna go back to Chantel. Let me share the screen. There, it's not so boring looking. Okay, let me see what we got here. Okay, so we're gonna take a look at Foodie over here. Just her recent, the cabbage live. Oh my goodness. The first thing she does is she comes out really sweating on the video, which was kind of wild. Very, very hot. This cabbage one. So if you see her coming out first, so let me try to hold on. Go back. Because when you
hot. Hello everybody.
Thank you, mods. So the first thing, she is excessively sweating when she comes on. Okay. Look at these tight layers of clothing. There's nothing breathing in the skin. Nothing breathing. This is where I'm concerned about something actually starting to kind of transpire with her, like, health around her mouth. You know, and then the skin. I mean, What do we say about Chantel's skin there? Okay, so I'm going to speed her up to the part where she starts to talk about her cellulitis. Hold on. So she talks about this skin infection here. Let me think. She talks about the cellulitis before that. Okay, so let me see where the skin came in, because she talks about the time in Thailand. Okay, so that's slightly after she talks about the cellular. Okay, so here she starts to talk about a skin infection right here. Okay, so let's bring her up. Let's get her talking about that skin infection. Let's just kind of hear her conversation around this.
I had a skin infection, like a small skin infection. That's all I'm going to say. And it wasn't fun. It's another reason I definitely want to like eat healthier and lose weight. But anyways, I was on antibiotics for it. And I also did so much. Like I slept a lot, drank tons of water, took zinc and vitamin C, like 2,000 whatever of vitamin C a day. Slept a lot, showered 2 to 3 times a day, just put like antibiotic cream, anything I could do to get rid of this infection. So it was wearing me down and I wasn't feeling well. So, but now I'm feeling a lot better. The infection is gone and, you know, alhamdulillah, and I can finally, oh my gosh. Yeah, something, I'm pretty sure it was something like cellulitis, yeah. Which is like, I never had something.
I'm pretty sure it was something like cellulitis. So what did they give you an antibiotic for? Do you really think that medical professionals just hand you pills because it's something like cellulitis? I think we need to kind of stop that rhetoric somewhere a little bit. I know there are doctors that if patients really push for, they'll get the doctors to give them an antibiotic, but it's becoming less and less that way here now, because people always push for antibiotics here in the United States to cure every, flus and all sorts of viral infections. So this already says to me that she's not received an actual diagnosis. She has Dr. Googled her symptoms, and maybe she got a triple antibiotic cream from somewhere. I don't know if this infection is healed. She seems to, I don't know when she was doing all this sleeping, supposedly, because it seems like she's been live streaming and mukbanging. And for somebody who would be on an antibiotic to eat the types of foods that she has been eating just would not fly. You're not going to want to eat anything spicy on that gut. I can promise you, because I'm living on dry toast over here and saltine crackers. That's the way I feel. Crackers and applesauce. And I have been for weeks. Everything is thankfully working normal. I have no signs of C. diff. Thank you, Jesus. Because I'm on 2 antibiotics. And I understand you will sleep, but I just don't think she's always done in 2 days. I'm on 1 antibiotic at the moment for 10 days. And I was on it just a couple of weeks ago for 7. And I'm on another one 4 times a day for 7 days at the same time as this other one. I'm on Bactrim and clindamycin. I don't even mind saying what I'm taking. So just as, we don't know what's going on, but we know that she's probably going to have a lot of skin issues going on just listening to our good friend, Dr. O'Donovan. All right, keep going, because she's going to get to a point about Thailand and the boil soon.
Something like that before, and it wasn't fun. So painful. Yeah. Hi, Louise. So I just want to feel well.
I'm not trying to trauma dump people, okay? But I'm somebody on the most part takes care of my health, and I just ended up with some post-surgical complication months later, and it's probably because my immune system went down, and I'm a healthcare worker, so I'm more exposed to things. And so yeah, it's been rough. But the fact that we see her coming out eating the quantities of food that she does and all of these different spicy things would say to me, she's not on an antibiotic. Because there's no way that your stomach can tolerate that. It's just your guts get, even when you're taking the probiotics and doing everything you're supposed to. I need to get the prebiotics, everything you're supposed to. You still have to be so cautious for things like C. diff and so forth, and just, destroying your gut microbiome. And so that's why it's just, for me, this just something smells real fishy. She's bought cornstarch and wipes. And I'm going to show in a moment, once we get to this next, recognizing moisture-associated skin deterioration or damage. And another potential thing that she's thinking could be cellulitis. Just because she's a larger lady.
Like one thing after another, then it was the sciatica. Finally, that is like healed. It's healed, but like I can still feel... no, it wasn't shingles. I can still feel like sometimes a little twinge.
Whatever, Chantel. You've never had an MRI to diagnose it. Stop going on about sciatica, okay? Stop milking your audience still. We all know you're a lie. You've never had it diagnosed. You've never worked with a physical therapist. It would just, you don't do anything. You exacerbate it by sitting on your tush all the time. Keep telling you got a problem with your piriformis muscle because you sit on your butt all the time. It's literally called the sitting disorder. I went over it one time before. So, I mean, you can have a big old slip disc act there, but I promise you, if you had a slip disc, girl, you wouldn't be sitting and eating and mukbanging and car driving like that, girl. You'd be writhing in pain, most likely. It'd be real uncomfortable. You wouldn't deal with that.
In my lower back, but the doctor thinks losing weight will definitely improve that 100%.
Well, Chantel, how are you going to lose weight, girl, when you don't exercise and you can't control your intake of carbohydrates? How in the world do you think you're going to lose weight? And then you sit in the car and eat a full quesadilla. How do you think you're getting all that cheese? How in the world do you think you're going to lose weight? Oh, doctor thinks if I lose weight. Pretty obvious, girl. Have you seen the abdomen in front of yourself? Oh, my goodness. Okay, let me not get sassy with Chantel, but she's just... this is where she gets irritated.
Zucchini's your favorite? Thank you, Hissy Fits. Yeah. So, anyway. So, this is all I'm going to eat for today. That was actually pretty filling now that I'm sitting here for a minute. And the sub, I kid you not, it kept me full up until like now, until I ate the soup. I was just starting to feel hungry. I'm like, I'm going to make a soup. And
this woman goes out and buys the tuna sub when she's got tons of tuna at the house, and she could have stuffed that into a pitter pocket if she really had to get her damn carbs in. But no, she had to get like full on, restaurant sodiumized, with bread the size of doorstops. And she gets two 6-inches. Girl, you ate 2 meals for most people, for your size. And then, of course she's going to lose weight and do all this stuff, And then you probably do have skin issues, girl, because you're not controlling this diabetes. Probably have a big old diabetic ulcer somewhere and boil.
Like, I don't know. That was a filling sub. But if you break it down, it had like so much tuna, so much protein, so many veggies, so it's not like a health food, but
no, it's not a health food at all, actually. There's usually tuna salad, which is, chocker full of mayonnaise, girl. Mayonnaise, okay? Let's just like eggs. On white bread. Big old white bread. Big old sub sandwich, because, this young lady, she just worked a full morning on a construction site. So she's, she needs to get 2 subs in. Because, she's been burning those calories, building a house or whatever. No, Chantel, you've been sitting there. You probably could have eaten half of the half. And then a bunch of vegetables. So say that sandwich is filled with vegetable, you're delusional, sweetheart. You're delulu.
Maybe if I had whole wheat bread, it would be even more filling. Hi, Linda Marie. Thank you. I'm glad you're here too. Care to explain? Like, nope. Cellulitis land. Yeah. Well,
she doesn't even bother to get the olive oil type of mayonnaise. I must admit, I do get some vegan Hellman mayonnaise. That vegan Hellman mayonnaise, I tell you, that thing tastes just like the original Hellman's. So if you can't tolerate eggs and you still want to get mayonnaise, I tell you, the vegan Hellman's mayonnaise has the same Hellman's recipe. Tastes like Hellman's. You never notice the difference.
I was like about to go because it was so painful, but no, I was fine with the antibiotics and the self-care I was doing. Like, it sucks that it takes me to get sick to like really get scared and kick into gear. While we're sick, we think, okay, I'm never doing this again. Just like when I used to drink and I would get.
I love hearing Chantel talk about her health journey because I know how hard she works to take care of her blood sugars, which are her biggest enemy to her health. I mean, she got a lot of enemies, don't get me wrong, but her lack of control for the type 2 diabetes is going to take her down. It never gets listed as the cause of death, people, because something else comes up that actually ends up being the factor that causes that. But she's going to have some issues. She is not on any type of health journey. We know that. She's going to talk about all her antibiotics and all this stuff she's been doing. Promise you, if you're on antibiotics, you're not going to want to take down 2 tuna subs. She's been eating like crazy. There's nothing that has shown. She has literally mukbanged every day since she got to Kuwait. So when were you taking all these antibiotics? I think she does have a skin thing going on because we saw the wipes and the cornstarch, which, makes me think it's under the breast and around the groin. And we're going to see these pictures. So just be prepared. Okay. Just want to warn people. It's obviously medical content. But yeah, I think she's trying to absorb moisture between her folds with that cornstarch. And that actually, I've seen some of that stuff caked on. It gets nasty. It's not going to do what she thinks it's going to do. She's probably getting moisture there. She's trying to dry it off. She's probably exacerbating it. That's what I
really
think from
sick.
looking
I'm
at the
like,
cornstarch and the
just
wipes.
make me okay. I'm never doing this again. And then when you feel better, you forget about that, The right recipient kept telling me they didn't get it, so I kept sending it. The number was wrong.
They aren't usually recommended, Charlie, especially if you have an open wound because you don't want those creams often to go into the dermis itself. But I did have one person who said that her doctor did give her an oral and a topical, but maybe with her cellulitis, it hadn't actually started to produce an exudate, like liquid out of it, which happens. But a lot of times they can get really red and really swollen and just hot to touch and maybe no seeping happening. I mean, that happens at the kind of the later stages. God, my grandma had some terrible cellulitis because she had congestive heart failure. So I know a thing or two about, and I've worked with a lot of cellulitis, as I've said.
Oh, there's so many horror nightmares about sending it to the wrong person, the message. Oh my gosh. So much fiber, you're going to be full for a bit. Yeah. I mean, vegetables do digest very quickly, but I don't know. Tofu, I love tofu stir fry, ghost face. How do you get your tofu like crispy without frying it? I'm in my comfy PJs. Yeah, I thought about food. Now you're making yourself.
Okay, she's going to talk about Thailand in a second.
We all must focus on healthy food, not about being fat or skinny. At the end, body is sensitive and we are all human. Yes, babe, exactly. I don't think sometimes we realize how fragile life is. You know what I mean? Like when you really think about it, it's like insane. It's scary. It really is scary.
Friend Chantel, I'm just going to say, how you live your life with so many risk factors, you don't show any respect to yourself or your body. You have no respect for your body, none whatsoever. For all the access to, even if it has some limitations, to even access to healthcare in the country you came from, it was already a privilege and an entitlement that you didn't even realize you had. And because of that privilege and entitlement, it has allowed you to abuse your body for years. And then you either Dr. Google it and try to fix it yourself, which probably it means it's not getting fixed, or you seek emergent medical treatment. You don't seem to have ever, because you're living as a tourist somewhere. So that means, guess what? You don't have a primary care. You don't have anybody overseeing you. You think just going back to your home country, picking up whatever month's supplies of drugs, ignoring your A1C and tootling it back off, you're going to be suddenly at the Everest Base Camp. Delusional.
Scary. Yeah, my infection is
Where's
gone,
Howie?
yeah. I think it started in Canada and it got exacerbated by like the being tired and travel.
Exacerbated. It sounds like you've been listening to me, Chantel, because I use that word quite frequently. I think she does sneak in here and tries to listen, and then she tries to come out here and make like she understands, whatever she searched on Dr. Google. Okay, because this person knows nothing about health. She certainly doesn't know how to manage her health, and she makes outrageous claims. This is a person who has not seen a dentist for 10 years and laughed about it in a video and has type 2 diabetes uncontrolled, which usually you should probably be in the dentist every 4 months. In her case, it'd probably be every 3. So this is somebody who's going to give herself endocarditis, sepsis, and an abscess in the mouth. This is the glow up queen.
Traveling, like I couldn't shower for like a whole day, because of the traveling. So I just kind of like.
Chantel, I don't think you not showering for a whole day is killing you, because everyone knew you were a filthy creature when you lived in that villa. So where you're coming out trying to say you're like the queen, we can tell just even how your skin looks. You're not managing stuff, girl. I know you always say you have rosacea, and I don't want to ever be harsh with people with rosacea because it can be very distressing. But I think that you're not even trying to control it. You're certainly not trying to use any diet or anything to help manage it. And I've seen people with really bad rosacea. So I almost think this is because your mask from your CPAP is too tight and it's causing a blood problem underneath your skin. I think that's what that is, because it looks like it looks shaped like your CPAP mask.
I was really sweaty, you know what I mean? And like traveling for a whole day and then just, I don't know, walking so much, like, yeah, it wasn't good. So I haven't drank or smoked in 3 months. Nice, Kiki. Good for you. Changes are possible. They're just hard. They are very hard.
Right here.
When I had my first baby, my hips obviously opened while I was pushing and don't close on my sciatic nerve. Oh, no. Yeah, a lot of people get like sciatica from pregnancy too. Yeah, because your body shifts, And same thing when you're like overweight, your body changes, like,
So she's saying she's getting sciatica from being overweight. Sciatica is caused because often somebody slips a disc and it then pinches the sciatic nerve. So does she have a slip disc too? That's the most common cause of sciatica. There's other causes too. So I don't want to, blanket it out like that. But she's not been diagnosed. She's just somebody who's not mobile. Sciatica, you want to be moving all the time. This doesn't remind me of somebody who's got sciatica, because she just sits there constantly. Yeah, Chantel, you probably, until you get an MRI, girl, keep talking, because you're just waffling.
So yeah, you're in a comfy PJs, Angela? I fry my tofu in a wok. Oh yeah, I wish I had a wok. Skin infection. They are more painful than you would think. It's weird. I never want that again, so I'm being extra careful. It's not about how you look, it's about how you feel. Exactly. Like looks really like they don't matter. Like in the end. That's why there's like this like girl, I like on TikTok, a pretty girl will get like a beautiful girl will get like millions of likes just for being pretty.
Okay.
It's like, so what?
Let's see where she talks about her skin, because Chantel obviously very jealous if anybody, you know, is prettier than she is. Okay, so she just went. I had to walk skin infection. Okay, here we go. Minute 40. Let's get over here. She talks about the skin fold. All right, let me click onto that moment. Can I get to that? Oh, there it goes. Okay. Let me.
Under the skin folds. Also, personally, baking soda. Oh, baking soda, really, Maria's? I didn't know that. Yeah, when you want to be pretty privileged. Yeah, that's what it's called. Yeah. He was there with his wife and kids, and he could face him 12 years in prison. See, like a mistake like that is not worth it for me. I would never do it. I would never disrespect the country and do that. Miriam come from? It's my Muslim name that Salah and I picked together.
We don't hear Miriam very often, do we? Okay, let's see what other health gems she tells us about. Let me look up real fast so we can speed her along. All right, so let's see if she goes into anything. Okay, let's listen here. She talks about at minute 52. Let's finish it up.
Not that good. I mean, they're not healthy, but having a few, I guess, if I could put them in my Fitness Pal. I'm still allowed 600 or something calories, but this, I don't know. I don't know if I should.
Have we seen the Fitness Pal out recently? She put that tuna sub in there. What a joke. The Fitness Pal. Chantel. I'm all for people who use fitness apps to help keep themselves on goal and help track their calories, their meals. Obviously, they're very beneficial. Girl, you're beyond a fitness app. Okay? That just gives you carte blanche to think you're doing right. You know, I'm sure most of the stuff hasn't been logged in there. How do you log in your homemade pizza pizzas? I mean, her mouth is her teeth. I mean, she's talking about being healthy, pretty privileged, and this, that, and the other. Girl, you don't even have pretty teeth.
I should finish the calories. I feel like I should because I don't want to like undereat and then like.
Probably wouldn't even be a candidate for implants or veneers because her mouth is probably so ulcerated and probably has so many problems going on. I mean, this woman just thinks she's going to walk in. If she had the money, she could walk into like a med spa and come out looking like Jennifer Lopez. I really swear. That's what this woman thinks. She's just eating herself into oblivion too. Bless her heart.
Cause a binge later, you know. But I don't want to cook something. Excuse me, miss. Yeah, glad you're safe, teardrop. Unfortunately, BBJ, if I wheelchair bees, it will lead to probably a jail of bees.
I'm not sure, but they're pretty sturdy dentist chair. So I'm thinking they either have maybe chairs of different. I know at my dentist, I don't know. They have nice mechanical chairs. I've had the same dentist. My dentist is a friend of mine. So I'm sure they have accommodation. There's a place in West Virginia, I always point this out, that every year all these folks go there. I would love to participate if I could, but obviously I have to always think about Junebug. Where they get doctors, opticians, just dentists, all of these people all there you know, getting all these people who don't have access to healthcare just taken care of in a day, and thousands of people will show up, and they'll get a ticket and they'll wait days almost to be seen, and they'll get their teeth, their everything. I mean, it's like life changing. And like I said, I think Chantel has been so privileged and entitled to have the access to the healthcare system that she has. She just takes her health for granted. Like, oh, Canada will pick me up again. Canada will take care of it. I know if she ever feels like she's going that far down again, she'll be back on a plane to Canada.
Chicken tenders are so good. I know they are good. They're one of my favorite foods. Yeah, Barbara, exactly.
Oh, yeah.
I wish it would just leave me alone. Like my brain would just leave me alone with that crap. It's like, do you want to survive or not? Like I thought we had survival instincts. So why is my brain like eat? Lachmas? Yeah.
It happens in West Virginia. It's a big thing in West Virginia. In fact, we're going to probably, I don't know if Chantel talks anything more about health, or let's see. She doesn't talk any more about health. Let's talk. We touched skin. We talked about she walked with a skin infection. And she talked about rubbing her skin. Okay. So let's see if she mentions her diabetes anywhere. It's about diabetes? Nope, she didn't want to talk about that. Okay. So actually it's in a place in West Virginia. I'm not sure where. Thank you, Michelle. Thank you so much for joining our club. Thank you so much for becoming a member. I really appreciate it. I promise you, I got fun things planned. Oh, thank you, Mrs. Muerta. Future shrink theoretically diagnosis, Foodie Beauty. Oh gosh, I would love to get her favorite Dr. Grande on here to give me his ocean on Chantel. I would love that. Unfortunately, our psychiatrists, they are very astute, and they're very much having to physically assess. So I think if I could get someone to speculatively, I've certainly done videos speculating based on what psychiatry I know or psychology. But yeah, I would love to do that. That would be fascinating. I would love that. Any of you who are there who do that, let me know. So yeah, this thing actually is out in West Virginia. And so I'm going to bring up the next video, and we're going to look at some. I'm just going to warn people, okay? These are going to have pictures of wounds, okay? And they are going to show parts of the human body. And they are going to be, you know, you're going to wonder what they are, and that's okay. I'm probably going to let you wonder so that YouTube doesn't demonetize me. Oh, you are a funny girl. Funny girl's a 4th year psych undergrad. Well, if you're ever interested, I have my email in my community tab thing, like the explanation. If you're ever interested and would like to come on and talk about it, I know you're not able to physically assess her. I know a lot of times some of these things, they actually have to witness the patient in these particular acts, like narcissism. They really need to actually see them actively demonstrating narcissistic style personalities. So I would love to bring you on. That would be fascinating. How many members? I am not sure, Miss Eloise, but I've been very excited. Wow, I've gotten 1, 2, 3, 4, 5 new members. So thank you guys so much. I'm not even promoting that much, so thank you. But I hope, you know, I mean, there's some that I'm gonna give away, but I'm just trying to figure out how to do that with YouTube. So there is gonna be a membership giveaway at some point, but I will let you know when that is. Okay, because I know they give me a certain number. So yeah. Mac Attack says there's a video called a BC Postmortem on YouTube. Oh, yeah. Oh my goodness. Yeah. Yeah. There is some very interesting. She says she'll send me an email. My semester just ended. Says something extra time. Well, that would be fun, funny girl. I think people would love that. You can go behind a little avatar, and we could discuss some cluster B. That would be fun. Be aware of sensitivities. Absolutely. Yeah. I'm not going to show anything that hasn't come from a medical location. I don't want to do anything that's going to make anyone stressed out. Okay. I promise you, I double checked everything before I decided what to show today. So yeah, let me bring this one up. Okay. This was a actual interesting, let me make this big. Discussion. It was called Recognizing Moisture Associated Skin Damage, MASD. And there are lots of different types of moisture associated skin damage dependent on the location of the body. And just having been someone who's worked obviously with a lot of female patients over the years, I kind of discovered where they tended to put the talc. And that's why I wonder with Chantel too. I don't think she's just limited to one skin thing going on. Not the way we see her sweating, not the way we see her wrapped in clothing. She doesn't look like she's often in breathable fabrics. They often look like they're man-made materials. She doesn't look like she wears a lot of breathing cottons. It looks like there's like heavy polyesters and not nylons, but maybe some nylons on the leggings. So she's not, wearing light cotton stuff. She wears like really heavy stuff. So this was a presentation on these. This is something when you're on the floor and an inpatient, you get pretty familiar with these moisture associated. And there's different types. There's all different types. And somebody was talking about this, the suppurative one. I need to go back and take a look at that one. And maybe we need to do a talk about that because I do want to talk a little tiny bit about the skin gut biome, which, especially she's been on all these antibiotics, which I question with how she's been eating. Because I've know how it makes your stomach feel. And you often don't want to eat these. You're often told to not eat all these spicy, rich foods because your gut biome has changed and it's going to could be aggravating to your gut. Okay. So this is one called intertriginous dermatitis. There is a picture. It doesn't really, you can't really tell, but it just kind of shows it. So just, it's a wound. It's not graphic, but I just always like to warn people because people can be sensitive.
Commonly known as intertrigo. Common inflammatory skin disorder that occurs within skin-to-skin friction and mainly in skin folds. We know the UK has a growing weight problem, and we also know that individuals to this category have higher risk of developing localized inflammation of the skin. Hence, it's very important for us clinicians to know what's the differentiation of the different MASD manifestation. Because if you identify intertrigo early, you can manage it safely. So intertrigo, it happens when there's localized inflammation of the skin in skin folds due to minimum air circulation, when the sweat is not able to evaporate. And remember the stratum corneum. This then becomes overly hydrated, macerated, facilitating friction damage that is often mirrored and on both sides of the fall. And obviously, as you can see,
so yes, we're going to make sure we're very sensitive on these topics. Obviously, we don't see the patient's face, but this is something that I do worry for Chantal. Just, I do worry about her. Bella can tell which area of the body this is. Some people may or may not be able to tell. And this can happen a lot for women. And then it can happen in the folds by the legs too. Just to be aware. Okay. But luckily I have trigger warning, everything, and obviously coming from a medical perspective. This is a medical talk available on YouTube.
It can be complicated by secondary infection, for example, fungal infection as well. How do we address this problem? Again, a holistic approach. Don't just look for the patient, as in the whole in the patient, but look at the patient as a whole. Check the skin folds, check every skin folds to make sure your patient, your service user are not at risk of intertrigo. And obviously use appropriate proactive measures instead of being reactive to prevent any detrimental effects on the individual.
And I know this is a tough one. This is really what we do see. We looked at some of the other ones, but this is the place where I see that talcum powder get caked in onto the skin, trying to keep this dry, and they'll cake literally that cornstarch in there, thinking it's going to stop the chafing. And that's not really probably the solution. And so when I saw Chantel with that cornstarch, started thinking about, these different disorders, and it's what's known as moisture associated skin damage. There's different types depending on its disease process, like how it got there. There's different, what we call etiologies. But this, I wonder, when she talks about things being painful, you could look up these symptoms and it could be very easy to mistake for something like cellulitis. And like I said, she is definitely not breathing under there. So yeah, just to be sensitive.
Happen.
It's very sensitive.
If you look at the common body sites, it can occur
Yes.
anywhere in the body
Exactly.
where two skin surfaces are in close contact. Do not forget.
And that's the problem. I think people put too thick of a layer of the talc on. I know cornstarch is used because people were moving away from talc product. But yeah, you don't like cake it in. It's like you put very light and you dust and you get off all the excess because you don't want it then getting the moisture and then becoming like something that's actually going to deteriorate your skin. And it's really important to clean it off daily because if you're caking, you could make it worse.
Get your between the toes, interdigital regions, be it on the feet or the hands.
Oh, come on in.
Skin folds. And also,
welcome to pharmacists. We got lots of other pharmacists in our chat, and I know they're going to introduce themselves to you. So come on in. We love our pharmacists here. Pharmacists are some of my favorite healthcare providers. They really are. I love pharmacists. They know more than you realize, guys. They got to know all these disease processes, and then they have to know what medications. And they'll come back and they'll question stuff. Don't you think that a pharmacist won't, man? Oh, they will. Get pharmacy alerts all the time. Oh, sorry. I meant to press play.
The axilla and the abdominal fold, behind the knees, under the breast, and the neck, and the upper legs, especially if there's skin folds. So very important to check thoroughly all these areas and implement appropriate measures. Identifying high-risk adults. So it's strongly associated, as we said, with obesity and those with skincare dependency. We've got loads of risk factors. A patient with diabetes mellitus, for example, they've got a higher pH in their skin and also immobility.
Oh, it's Bella's friend.
So others include
it's Bella's friend. Hey, we got all these great pharmacists coming in from Vanderbilt, guys. We've got some really good medical professionals in here. I'm like feeling honored around here. I'm just like a lowly little registered nurse with a little bit of grad school behind me. I feel honored.
Urinary and fecal incontinence.
I had to rely on my pharmacist though.
Or restrictive clothing or shoes, particularly using synthetic materials. But
I think we need to go back on this. Okay, and I want to make sure she's loud enough that everybody can hear her. I think I know on one I had subtitles. Maybe I should have put the subtitles. All of these things. all of these are risk factors. All of them. I'm not saying but she's got a very high likelihood of getting this type of skin disorder. And, you know, I hope not for her, but I hope that she really does take anything happening on her skin seriously and follows up with a doctor, especially as a type 2 diabetic who is going to have compromised healing. All right, let me go back a little bit because this I felt had really. All right here. All right, let's go back to the risk factors.
As we said, with obesity and those with skincare dependency. We've got loads of risk factors. A patient with diabetes mellitus, for example, they've got a higher pH in their skin and also immobility. So others include urinary and fecal incontinence, people wearing tight or restrictive clothing or shoes, particularly using synthetic materials. But don't forget, we've got a newer group that are very high risk of developing intertrigo. They are the post-bariatric patients who have undergone significant weight loss, but have been left with large amount of excess skin and extreme skin falls, which may require skin surgery. And these patients are also at risk. So it's really important to identify and classify these intertrigo early. As I said, early detection is key.
Thank you so much for becoming a member, Miss Kathy Brown. I am so excited you're joining the Life and Vibe community. I am going to be. I just say I am going to show my little video at the end. I still haven't voiced it, but yeah. See, this is where when you look at those, and we're going to take a quick look at a cellulitis real fast. This is why I keep kind of, you know, it is potentially that she had cellulitis, but when I see like the lady wipes and the talc or the cornstarch is what she had, that's why I go to here, because I've seen people try to manage this at home using those types of products. And I would think that she's probably wiping any excess. She could have it between the, you know, her folds of her groin area or the upper thigh, I should say, to be super polite. And so she could be potentially using the wipes to wipe away, you know, the talc or whatever. And then I hope she's letting it dry, but then she's probably putting talc on to try to stop any of these issues. It could be between the legs, but the way she wears those restrictive clothing, the sweating that we've seen her do recently, we watched at the very start of that cabbage video that she was sweating quite profusely despite the air conditioning. And then we looked at 12 different things that could lead to things like diabetic ulcers and all those swollen boils and things that we looked at and all the different other skin conditions. But like I said, just it kind of like goes into this. Okay, this is the last thing I think we'll finish up on, unless you guys want to listen to the skin microbiome. And I need to do a poll before I leave. I don't think we'll know what she really had. But I hope she's at least just not Dr. Googling everything, because as an active diabetic type 2 Chantel, you can't let skin infections go. And she just seems to get antibiotics out of everywhere. It's very questionable.
Conduct your holistic assessment. There is no formal standardized risk assessment tool for intertrigo in use currently, but use your holistic assessment to actually check the patient, the person themselves, head to toe. The diagnosis is dependent on the risk factors, which we've just looked at. It usually starts with redness, inflammation, but likely to develop to fungal infection. So classical clinical signs include mirror image erythema in the skin folds, and sometimes accompanied by sensations of itching, stinging.
What she means by mirror image, when you remember we looked at it, it's like on both sides, both they are going to have redness, erythema being redness.
And burning. I will now hand over to my colleague, Marianne Obbs, who will talk to you about peri-wound moisture and peristomal.
Yes, we will not be covering the peri-wound moisture. That is not something we're going to cover. But this, when I finish up the video, I'm going to make sure I link also Dr. Donovan's video. I'm going to link this for anybody who's in the field and just wants to learn a little bit more. I had a lot of my, colleagues, I would have to kind of show them the difference between moisture-associated skin damage and pressure ulcers, because those two can often get confused for certain types of moisture-associated skin damage. And so that's kind of what I want to really to be able to discuss this today, because I think there's so many things beyond just considering, obviously, cellulitis. So let's quickly look at cellulitis. There's not really a lot of videos explaining cellulitis. So a lot of you probably already saw this. I'm just going to come over to the CDC real fast. Okay, so here, obviously, a lot of you have seen this. It was a common bacterial skin infection, causes redness, swelling, and pain if untreated. And the thing is, you can get cellulitis in the feet, it's often the feet and the legs. So I'm wondering, we know she walks oddly, but she could have had an ulcer. She could have had a diabetic ulcer that became cellulitis. That's potential. If she had a boil somewhere, it could have become infected. But she needs to really get serious antibiotics going. I think Chantel, definitely seek medical attention immediately if the red area of the skin spreads quickly or you develop fevers or chills. I just think, oh, well, she's got being overweight. And they talk about the lymphedema. I have a lymphedema episode planned. I'm trying to make it exciting. I read a lot of papers on lymphedema yesterday. Found out it's really a genetic disorder coming from the father. It's quite interesting. Okay, so oral antibiotics. Not usually complications. All right. But yeah, could she have cellulitis down on the bottoms of the legs? It's possible. Like I said, she sits dependent a lot. She could have had an ulcer. We know that can happen. So we don't know. We just don't know. All I know is that girl bought a lot of talc, which makes me think of the one I just showed, which was the intravenous dermatitis. Okay. All right. So I don't want to keep taking up everyone's time, but I did want to just play this one interesting thing about the skin microbiome from these doctors real quick. Won't be long. I'm not going to play a lot of it. Don't worry. Or unless people stay interested in the topic. But this is from the dermatology show on Doctors Radio. Let me show the tab. This one was quite an interesting one. They talked about skin microbiome, obesity medication. We're not going to obviously cover all these things. And they also covered precision medicine for obesity. And they covered weight, pre-diabetes, and obesity, microbiome health, and GI issues. And this first one, which is the skin microbiome in dermatology, which I thought could be interesting to also listen to real quick, because, what we are discussing is literally the skin microbiome today. So I thought we'd just finish out here. I do love some Doctors Radio. So let's have a listen to what these smart doctors have to say today.
Day. And during our second half of the show, we will be discussing precision medicine for obesity with Dr. Andres Acosta from the Mayo Clinic. You can follow us on X or Instagram at NYU Docs to find out all of the topics we're discussing on each show. And if you have a
I'm interested. This doctor's coming from the Mayo Clinic. We like that.
Question or comment, you can interact with us live by sending us a DM. We might just share your question live on the air. And also like us on Facebook by typing facebook.com/SiriusXM Dr. Radio, all one word. And lastly, you can call in with questions. This is a live show, and we love to hear your voice and want to speak with you. So give us a call at 877-NYU-DOCS. That's 877-698-3627. You can also email us with any questions you might have to docs
So Pat, I found some fascinating journal articles yesterday. I mean, I got deep into the study. And I found some really interesting articles. Some were very scientific, but recent, all within the last 5 years. So I found some really good cited studies on lipedema. And so I'm trying to make it exciting though, because it's the articles look dry. So I'm trying to think about how to jazz it up a little bit. But it was fascinating. It was a fascinating topic.
At SiriusXM.com. And now, without further ado, it is my honor to introduce you to our first guest today. Dr. Doris Day, MD, MA, is a board-certified dermatologist and a fellow of the American Academy of Dermatology. She specializes in laser, cosmetic, surgical, and aesthetic dermatology. She's a clinical associate professor of dermatology at NYU Gross.
That's interesting to know. And I know in Germany, they do a lot more towards naturopathic type medicines, because the reason why I follow a vegan diet in menopause is due to German studies. I'll just let you know.
In School of Medicine and NYU Langone Health. She has written 4 books, people. 4. That's a lot of books. Beyond Beauty is one. Forget the Facelift. 100 Questions and Answers About Acne. And her latest book is titled Rebooting the Microbiome: How Properly Caring for Your Skin. And
yeah, I got some of that chlorhexidine wash in my house because I had to buy some before I went to surgery. Every once in a while, I'll use it on my hands before I do my skincare. I try to be careful with it, though. But yeah, I got some chlorhexidine.
Biome can do more for your health and beauty than any skincare ingredient on the market. Dr. Day is also one of our esteemed hosts on Dr. Radio. She hosts the Dermatology Show, which airs live here on Dr. Radio Thursdays from 6 to 8 p.m. Eastern. And you can follow her on Instagram at Dr. Doris Day, Dr. Doris Day, all one word. Welcome, Dr. Day. We're so excited to speak with you today.
Oh, great. Thank you for having me. And thanks for that incredible introduction. I'll try to live up to it.
Oh, my God.
Oh, Dr. Day, she's great on the dermatology show. So this is quite interesting to have her here. About the feminine wipes, I don't think it's also, I guess when I think ulcers, I'm always thinking pressure ulcers are very different from other type of ulcers. Okay. Pressure ulcers happen on bony prominences because people are immobile. Hers might be coming more from diabetes if she's had like the ulcer, that boil we saw. It's a lot.
That's the least we can say about you. There's so many things you've done. So we are very interested, as a gastroenterologist specifically, I am fascinated by all of the different things we're finding out about the microbiome with time, right? And so your latest book is about the connection between our skin and the microbiome. So what got you interested in this topic?
I've been interested in it for a long time. I think a lot of it is understanding even things around human papillomavirus, HPV, or the common wart, and also it's a cause of squamous cell carcinoma, and a lot of cervical cancer is related to HPV virus. So I realized that in the skin, there's so much that happens with infections, and a lot of what can be cleared is looking at the skin microbes. We're teeming with bacteria. Your skin even has its own natural immunity. It has something called Langerhans cells. So your first line of defense from the outside world is your skin. And it made sense to me that since we can't live in a sterile environment, we must have adapted over centuries, over our whole evolution, to live with these bacteria. And just as with the gut, where we learned that some of those bacteria and those microorganisms actually help us, this could be true in the skin as well. And then I met a PhD, Dr. Thomas Hitchcock, who's the co-author of my book. And he created a line of skin probiotics, not the line itself, but the probiotics called Zycrobes. And they're a type of bacteria that naturally live in the skin called C. acnes, which is what we're always blaming for causing acne. But what he showed was that there's many different strains of this particular bacteria. So now when we look at bacteria, it's not even just looking and saying, oh, you have the bacteria called C. acnes that causes acne that you see, and we must give you a whole slew of antibiotics to knock it out. Instead, what we have to do is look at the strain of that bacteria and look at what else is missing in your natural biome that allowed.
That's what Bella was saying too. And I know my doctor has been desperate to be able to culture what's ever happening in my nose. But every time I see him, I'm never draining, unfortunately. So it's like always the day after. It's like, I have a feeling that's going to happen. And I have an appointment with him on Friday. But I'm glad to, I know that's a lot of work. Trying to get those cultures, but it's so important because you don't want patients and then you're touching patients and then, you've got your gloves on. I mean, I always put gloves on when I went into a patient's room just because I never could really, sanitized, got the gloves on because I could never really be, clear what was on surfaces. At least come in at least a little clean. But there are plenty of nurses, there's people are in a hurry, but it's important to isolate people if they are infectious and make sure that you're using the proper personal protection equipment in order to the good old PPE before you go to the room, depending on which type of infection it is, or it might just be that you have to have certain technique.
This to happen. So what we've done is we've learned that when we do a culture, we say, okay, what's overgrowing? Is there staph overgrowing? Is there strep overgrowing? Is there Pseudomonas? All these different bacteria that can overgrow. But what we never look at is what is missing. What are the good bacteria that are missing that would keep those bad bacteria in check? And if you take good care of your skin and you have a healthy skin barrier and you don't do too much else to it, your skin can now.
It's probably because the nurses are complaining about having to get the cultures. Unless they have a team that does cultures. Because I've worked at some systems that, you're doing everything as the nurse. Gosh, I used to dread when they would want to get the blood cultures. And I have to get it from the different spots on a patient I can barely find a vein in. You're not pulling from an IV, obviously. You gotta do a venous stick and actually pull 20 ml of blood out from one place and 20 ml from the other. 10 and 10, I think it was. It was a lot. I hated blood cultures.
Actually repair your skin, the sebaceous glands, those oil producing glands that we're always trying to dry up and do all these peels and scrubs with to try to reduce those are actually getting rid of food for these good microorganisms that can keep your.
See, so what the doctor's saying, and I don't use peels or scrubs on my general body. I don't really scrub on my face too much either, I have to say, because the pads of your fingers and the action of you doing the soap with the pads of your fingers, that's all the friction your skin needs. All those other types of products could actually, I'll let the smart doctor keep talking. She'll explain.
Skin healthy, and those microorganisms, just like in the gut, they make short chain fatty acids, they make antioxidants, they make things that hold enzymes that might keep the staph at bay or the wrong strain of staph at bay. So we have to curate and nurture our natural biome, not try to mess with it too much. And it's really changed the way I treat acne, rosacea, eczema, and other skin issues that are very common.
Such an excellent.
So, Sam, I hope everything goes well tomorrow. I know you had that incident with your stroke. I hope you're doing well, sweetie. I really do. I'm glad you're getting your eyes checked and new glasses. I'm glad you're taking care of yourself. That's excellent. Yeah, good luck, Sam. Good luck with that. All right, keep going, smart doctors. I love this doctor. She's one of my favorites.
Point. I mean, we talk a lot these days about the microbiome, the microbes that are living within our gut, but each of our organs kind of has its own microbiome. Our skin is the largest organ in its body. It has its own microbiome. Your nose has its own microbiome. Women's vaginas have their own microbiome. They all have their own unique host of different microbes. And so with the skin specifically, we have kind of delved more within the GI world about how we as gastroenterologists can help people fix their skin or other inflammatory conditions in their body through the food that they eat and through nourishing the microbiome. But you're taking it a step further by talking about the actual skin's microbiome, which is so fascinating, and how we can kind of adjust that and optimize it. And so do you feel that it's best to kind of go through the route of topical and fix it topically, since these microbes are living on our skin, or is it kind of multifactorial through the gut and through the skin itself and that connection?
Oh, that's such a great question. It's absolutely multifactorial. There's a really good article written by a dermatologist several years ago, Dr. Haynes Ely, and it's called Is Psoriasis a Bowel Disease? And what he talked about was certain strains in the diet, certain things in your diet, like high intake of alcohol, high intake of certain foods, led to something called leaky gut. And that created inflammation. And if you were prone to psoriasis, that would cause psoriasis. So spicy foods was a big thing for him too. And in his article, he talked about doing an elimination diet where you eliminated anything hot on the tongue, onions, peppers, anything hot and spicy, not heat hot, but spicy hot, and give up alcohol. And then there were two supplements. It was quercetin and duozyme. Duozyme, I'm sure you know, is a bile acid. So you can supplement with these. They're cheap on Amazon. And he claimed that he could cure psoriasis with this. I mean, cure is a big word, but
Yeah, cure is a big word for psoriasis. That's interesting, though. My grandmother suffered horribly from psoriasis, and she had like not the best diet always. It was pretty basic, you know. I guess this is interesting because we have to think about how Chantel eats, and then what is she also doing to the skin? We know through the diabetes, but just the skin health altogether. So not only is she complicating her health with her type 2 diabetes, unmanaged, uncontrolled, she's also compromising it, probably because she's not getting good nutrition. And I can promise you, I have noticed, like, since I've been on these antibiotics, I've been very limited with what I've been able to tolerate food-wise. And I have noticed that I have like a little eczema thing, and it's kind of come up because probably my gut health isn't perfect. It's okay, but it's not perfect. Obviously. So it is amazing. Everything connects to everything. So when Chantel talks about all these things about her health and trying to improve her health and trying to get healthy, you kind of have to think and consider to yourself, how, but how you eat is having such a huge impact on your health in every aspect at this point.
I think he meant long-term remission. So I've had several patients who they were covered in psoriasis. They didn't want to do biologics, and they were highly motivated. And I had them follow that protocol, and they were cleared. They were totally cleared of their psoriasis. I mean, that was, to me, so mind-blowing to show that in some people, that gut-skin connection is so powerful. What you put in your body, all these processed foods that knock out your gut biome, that inflammation is going to show in the skin. And sometimes it'll show in the skin first, but also as the canary in the coal mine, that if it's happening in your skin, it's happening in your brain, it's happening in your heart, it's happening in your joints. And so we have to pay attention to the skin, to the gut, but the skin can help us see that before the gut will show it to us in other ways in terms of other diseases.
That's so fascinating.
So if anything can encourage anyone who just stops into my chat, especially a lot of young people who like to eat a lot of takeout and fast foods and all of these different things. I know they're tasty. Okay. I understand. I was young once too. I like cheese pizza once too. I'm eating dry toast at the moment. But I think that you have to think, what is really with these ultra processed foods, even if it's like an ultra processed protein supplement or something, they are ultra processed. Okay. So I just think being aware of how much of that type of food product, as I like to call it, is being consumed is really important. I can't stress more than enough just a good whole food nutritious diet with real foods on that plate, as much as you can keep away from, frozen ready-made meals and so forth, it will do you good. None of these things are showing to do us anything of benefit except save us time.
Thing that we have, kind of been beating around the bush talking about for a while, even within GI and gastroenterology as a field, particularly with inflammatory bowel disease and the different skin manifestations that people have, this severe autoimmune condition that impacts the lining and sometimes the entire wall of the gut.
I'm going to have to get some of that seed and all of these different things. I need some prebiotics. I think I do, because I'm hanging in there. I have no sign of C. diff, just not to be horrible. But I definitely don't feel comfortable in the gut fully. And I feel like I have a sensitive bowel ever since I had amoebic and bacterial dysentery in Mexico. Like, my bowels have never been the same since the dysentery.
In different areas. For ulcerative colitis, it's, obviously the colon and the distal part of our GI tract. But for Crohn's disease, it can be anywhere in the GI tract from mouth to anus. But there are multiple skin manifestations. And so, there has to be a connection, right? And so it's wonderful and absolutely wonderful that we have.
I'm trying to persuade my friend who's a dentist to come on. I want to get my friend to talk about the complications of diabetes. I tried to talk to my friend about it the other day. I'm going to try to see if I can get her on one night. She goes to bed pretty early, so maybe a weekend. But she's very busy. She's always out of town. So, but I'm trying to get a dentist to talk about this, because I think that would be really important. But they're busy people.
Scientists like yourself who are kind of demystifying this for the masses. And so I highly recommend people go out and get this book, Rebooking the Microbiome, How to Properly Caring for Your Skin Biome Can Do More for Your Health and Beauty Than Any Skincare Ingredient on the Market, by Dr. Doris Day, our guest today. So if you have any questions for myself or Dr. Day about this specific topic, microbiome and our skin and how our gut and our skin are connected, give us a call at 877-NYU-DOCS. That's 877-698-3627. So on
one
this
of the
topic,
good news is
yes, go ahead.
that one of the good news is that it's starting to be taught. When I was a resident, it's years ago now, but we didn't even know the exact cause of things like psoriasis. We knew it was immune mediated, but we didn't know the path that caused it. Once we figured out the pathway, then we could develop biologics.
I knew my grandma needed to be eating better. And, and obviously as her appetite waned, as she got older, her psoriasis became a little worse. She really did suffer with that psoriasis, my grandma.
But so much of what we do in medicine is geared towards pharmaceutical interventions rather than what you have control over. And unfortunately, a lot of what people want, what's easy, is, I would say, we're all going to die of a side effect, because there's a pill for just about everything. Everything has a side effect, and there's a pill for that. And eventually we're going to hit a.
And this obviously is in the realm of our pharmacist world here. But like most of these pharmacists will tell you, they don't want everybody on a lot of medications, because they understand the interactions and the long-term effects of things. So it's very hard when you have especially here in the United States, probably more so than other parts of the world, where pharmaceutical companies are very able to advertise every drug, pill, you name it, on the TV when they're releasing a new product. So they're constantly having ads here in the United States. Oh, they have the Ozempic ads. They have, you name it. Any new drug coming out. Nexium, I think, was the purple pill, came out at one point. Whichever pill, Viagra is on here. You name it. You name the pill, it's on the TV here. So all of these, people who see it on the TV, and they're being persistently sold a message that there's a pill for everything. And that seems like such a faster fix than actually making lifestyle changes or eating a little better or checking your blood pressure more regularly. No, I've had patients pre-diabetic, and even I'm very honest about this, and it was the scariest thing in my life, because I'm a skinny person, okay? And I was working as a night nurse. I used to do a lot of shifts in a row. My diet was terrible. I was exhausted. It was during the panini time. I had patients, obviously, since I did work in patient hospice, I had patients, obviously, passing of multiple different complications. Obviously, patients with what was actively going on at that time. It was exhausting. It was very stressful. It was very exhausting. And, you were doing a lot of shifts. I mean, you're making money, but you're tired, especially night shift. And I had my A1C taken. I've never had problems with my blood sugar, always been great. I was just at pre-diabetic. And it scared the living daylights out of me. I could not believe it. That somebody who had been a runner and fit and healthy and all of these things, suddenly I found myself pre-diabetic. I was like 5.7. I was like just over, but it flashed up. Now it's in my medical record. And so I have tried to work diligently to try to reverse that because I don't seem to have the risk factors. I don't, but maybe I was eating too many carbs at the time because I was, lacking energy. So I used to go to this vegan bakery and get like vegan donuts and bready stuff and things, I was eating a lot of carbs, probably because, like I said, I was energy deficient. And it was a wake-up call. Anyway, let her continue. But that's my story. And I'm not ashamed to admit it. I weigh like 136 pounds at 5'9". Nobody would ever think I was even close to it. That's why I say it's so important to watch these things.
Side effect of something that's going to, be a circular thing, and that's what's going to get us. But my hope is that by understanding the biome and sort of respecting what our body naturally does and nurturing it, minimizing alcohol, minimizing highly processed foods, simple sugars, even following things like gentle intermittent fasting, just 13 hours a day. It doesn't have to be eat only 2 hours a day, just eat in 11 hours a day. And minimize your time, give your gut a chance to rest and recover, and use sun protection, use products, don't have a 15-step routine, keep it simple, understand the power of cleansing, and just very basic things. It does not have to be overwhelming. That's the beauty of this, is that a lot of what we're talking about is doing less.
And Chantel goes to the extreme always. So she says she washed 3 times in a day. I don't think our dermatologist here would recommend this. If you ever have access to Sirius Radio and you can listen to Dr. Doris Day on the dermatology show, it's fascinating. If I could have been a doctor, I would have been a dermatologist. I'm fascinated by the skin.
Less, not more, but not just saying, I want to live my life and then I want a pill to solve my problems. That's the change in sort of mindset that we have to approach. And it starts with the physicians and the training of physicians.
Absolutely. And getting more people to understand the process.
I think she is trying to dry her skin out because she could have that moisture. You probably missed this part, but what we call moisture associated skin damage. So she's probably getting a lot of moisture. So she's probably thinking now, she probably if she really did shower 3 times, she probably stripped stuff off her skin. That's why, I know people, guys will really do it a lot. They'll shower a lot, and it feels good and stuff. But I think you have to also consider how much of the good bacteria you're also removing from your skin when you're just, because there are all sorts of studies, and I know our pharmacists here will back us up on this, that show that like using antibacterial soaps like Irish Spring and all these things are actually very bad for the skin. You actually take off so much of this skin microbiome. I always tell people, do not use those antibacterial soaps. It's, I understand that people used it for like probably under the armpits or whatever, but men love that stuff. All those antibacterial soaps, I never allow that in my house. I just use regular soaps. Like I said, Dove Sensitive, my favorite. But yeah, just be cautious with those antibacterial soaps, folks.
Just so that even the primary care doctor can talk to their patients about it and recognize issues and refer out to the proper clinician. So we have an excellent question that I actually wanted to ask myself. So I'm so happy that Bob from Florida.
And that's actually what I do. I shower every other day, and then I, obviously clean my bits, on the day I don't shower, just because I do have a tendency to eczema. And that's why I'm fascinated by skin. Not terrible. I have a different type of eczema from the one that most people think about. But yeah. So I then, make sure right after the shower, I put my like non-fragranced body moisturizer on head to toe. Use a different moisturizer obviously on the face. The face gets washed twice a day, obviously. It's a little different. But I use very gentle, products there, and always a moisturizer. Sunscreen in the day, obviously. Absolutely. Best advice.
That beat me to it. Bob, how are you today?
Well, good morning, and thank you for all you do. My question is there any evidence or do you have any speculation between the connection of the skin microbiome and predisposition or protection from skin cancer?
Okay.
That's a great question.
Oh, yeah.
Dr. J, what do you think?
Yeah.
Well, that was a skin cancer question. We're not quite there. That's obviously interesting. Let me see. We're going to go along a little bit here. I know that was not a very interesting question, but obviously we're not really touching skin cancers.
Actually, zinc is
okay. Let me see. Not that I'm trying to go back. Okay. Let me see. She talked about zinc there.
over exfoliate, meaning that listen to your skin, and generally about once a week is enough. And a glycolic acid is fine. You don't need super high concentrate of those ingredients to get that, but your skin does naturally exfoliate and clean itself. So you don't have to overdo that. Retinols are fine. Using these combinations of simple ingredients and then proper...
I'm guessing you were a swimmer. Because it happens when you're obviously somebody who does sports, you're showering more frequently, which is potentially maybe, and so, yeah, it's definitely, you do want to get that sweat off, because sweat isn't good for the skin either. So but probably in those times, I would consider sometimes if every shower needed soap. Do you know what I mean? But it's hard when you smell like chlorine, because you want that chlorine smell gone.
Protection, meaning being sun smart. Actually, zinc is better for the biome than a lot of the more absorbed. People call them chemical and natural, but everything is a chemical. So I call them absorbed and non-absorbed. So the zinc and titanium are the non-absorbed. They sit on your skin almost like a layer of clothing. And the avobenzones and the other absorbed sunscreens go into the body, and some of those are less biome friendly. But also the zinc-based sunscreens, because they're inert, often don't have preservatives, and that also makes it purer and better for your skin. So looking at those elements, having simple skincare, there's lots of, in terms of the anti-aging component, there's great peptides.
And I love this message about the simple skincare. And this kind of follows up on Chantel with all those fragrances and the Lush stuff and all these things that she bought. That a lot of times, obviously, it's fun to have fun products. Don't get me wrong. I have been a fan of moisturizers and body creams and skincare for decades, long before TikTok existed or an influencer, and using sunscreen in the 1990s on my face and getting facials and doing all this stuff in the 90s. Yeah, we did that in the 90s. And it's just one of the things I've learned is just to keep the routine simple is one of the better things. You see all these young people and they're introducing like really young children to excessive skincare routines, and it could potentially, I just don't think people realize it's the largest organ in your body that has a role to play other than being seen on TikTok. And so I always like the message that simple is better. And most of the time that's what we say in medicine. But the patients are the one who demand the medications from us. Often they want the simple fixes. Often, because that's the way our culture is.
Love exosomes. All of these, if they're used in the right combination with simple preservatives and not high concentrations of them, can be totally biome friendly and great for anti-aging. But you know what? One of the best anti-aging secrets is sleep.
Please do
Just
tell.
getting enough sleep.
Getting enough sleep.
It's free.
Oh no.
Get enough sleep.
Except for the
Sleep
people who
does
are up all
wonders.
night worrying about their skincare regimen.
Exactly.
That's so true.
And those of us who are in healthcare, sleep is precious. That's why it's like, oh no, sleep. Because we're probably one of the professions that gets sometimes the least amount. So it's, it can be difficult when you work in healthcare because you understand what you need to do, but the lifestyle is preventing you from sometimes carrying all those things out. That's why the nurses like the 312s, but I promise you, those things will kill you. It's a young person's game.
True.
Sleep and water. We need those two things.
Yes, there's so much
And they're
cognitive
basically
dissonance
free.
when it comes to water and sleep. Everyone knows it's good for you, and we talk about it all the time. We tell our patients to do it, but we are so bad at doing this ourselves.
Uh-oh, Foodie's favorite, water and sleep. She thinks that, obviously it's a very important message. Foodie is needing a little more than just water and sleep. I'm glad she's improving her sleeping. I'm glad she's not in the middle of the night. I think she's behaving. Well, she did the 1 a.m. thing, but so let's not rush to anything. But yeah, definitely. Get your waters, guys.
And when it comes to the water, I tell my patients not to follow a strict, you need to have 8 glasses of water a day. I'm like, just look at your urine. Your urine, there's people out there who are like going to aura readings and psychics and, getting mood rings. But ultimately, you have so many things like free tests at your disposal. And, this is, again, I'm a gastroenterologist, so I feel very comfortable talking about this. I'm like, look at your pee, look at your poop. It tells you so much about yourself and your body that you...
Now you get a quick glimpse into the world of healthcare professionals, everybody, because yes, if I would be lying if I did not say I did not look at those each day. I would be a liar, because yes, we certainly are looking at all this stuff. I love these guys.
Otherwise wouldn't know. It's like a free at-home diagnostic tool. Just take a look. So
what did your
I
poop
always
say?
recommend
I
it.
love that.
Yes, exactly. I have a
Oh, Eloise, you would have loved me then because I had to keep my patients clean as a whistle on hospice. I did not allow, I could tell when my patients were uncomfortable and like rolled up in a ball and then comfortable as ever after a good clearing of the colon at the end of life. Makes a patient far more comfortable. My colleagues used to hate when I get to the floor because it was like laxatives to everybody. They always say, oh, we don't raise on the floor. But yeah, it was one of my things.
Really a dermatology horror story to tell you. So when I was younger, I was, in middle school, and I really thought that to prevent any sort of acne.
I can promise you I followed protocol. So we used, if we didn't get, I don't even want to tell you what enema story I had. It probably was one of the most horrific things from somebody. I'll leave that to a night episode, but it was pretty bad. And it involved a very, very extremely large blood clot or two. And I'm talking like size of children blood clots.
And this is like in the 90s. To prevent any acne, I needed to make sure that my face was as clean as possible. I didn't understand the microbiome well at all. And yes, 20 years later, I'd become a doctor and I would learn more about it. But I would take rubbing alcohol and clean my skin with it every night. And I have so many regrets. And every time I go and get like a facial or anything, they're like, the skin remembers. But now
that's something I haven't really had a lot of since I've been sick is coffee, because of its diuretic effects. But yeah, certainly that's definitely a way to guarantee a bowel move before the house. And the prune juice. Oh, yes, absolutely. I always like to do and exercise, walking. But if your patients are immobile, you have to do the other. But laxatives, you need to be cautious because you take out your electrolytes and stuff. So, just be careful of those skinny teas and stuff because it's literally just a laxative product dressed up in a, supplement sold to the masses.
But I think
The good
about
thing is
like
it
your
doesn't.
book. It doesn't. I hope not, but I think
No.
about your book and the things you're talking about. And, 9 and 10-year-old me would really be mortified at what we're discussing.
Yes, it involved an enema and a patient with dementia and constipation. And I was having to make a home visit, and the family hadn't been, properly keeping up with her bowel movements, and she was dementia, and she was trying to actually remove what was stuck with her hand, and so it was all stuck in her fingers and stuff. So we knew she was uncomfortable. She was in a lot of pain, and they had been trying to do the other, and obviously the decision was made with the doctor to give I think it was a saline. We just did a saline and enema. I can't remember if we did the oil, the mineral oil, or the saline. I want to say potentially we did mineral oil. I think we did mineral oil, which is the one I was directed to use. And my goodness, that lady has obviously been constipated for some time, or something was causing her, because the blood clots that followed were something I have never seen in my life. And the bleeding went on for about 30 minutes. She survived. The doctor didn't think she would. And after that, actually, and the family got regular about actually getting her not getting constipated, she was able to come off hospice. So that just goes and shows you.
Discovering and talking about these days, because I'm sure I was really hearing those microbes screaming, "No, save me!" But it was really
the
quite bad.
interesting thing about rubbing alcohol is that it has no effect on the bacteria that causes acne. It has zero effect on it, but it does dry out your skin. So one of the things I tell
I always try to trigger warning, because obviously when we do get into topics of health, it can be a little TMI. I understand. That's why we try to be as sensitive as possible in these topics, because they're tough. They are tough topics, especially when some of my clinical experience has been definitely interesting.
specifically, I don't even ask them if they're doing it or not, but I just say it. Don't use rubbing alcohol or hydrogen peroxide on your skin, because they're toxic to the skin and they have no effect on the bacteria that you're trying to fight.
Actually causing the problem. They'll just kill the good bacteria, right?
Exactly. They killed exactly. And the thing is, it's one of those.
I'm wondering, a lot of times people will activate the vagus nerve, and that can cause people to pass out. The vagal nerve, they can vagal. I've had the patient do that in the hospital. He kept fainting and nobody understood, and he basically threw a vagal in the restroom as he was having that particular thing happen.
That you learn, and I would say for every regret, you do 10 things differently that make that regret all worthwhile. So that one regret, look at you now, you're a biome expert. You're focusing on the gut and all the microbes and bugs, and you live with bugs now, and you're like nurturing them and encouraging people to actually eat them sometimes. Like, how amazing is that?
It is amazing. And I have the
awesome.
opportunity to speak with experts like you, which is even more amazing. So we have some callers actually waiting to speak to us, some local callers actually from the local area. So Josh from Pennsylvania. What's going on, Josh? How are you today?
Doing well. Good morning. A question for both of your traditions here. Long-term use of protonics for Barrett's esophagus.
Okay.
I've noticed.
All right. They're off on another topic there that I don't think we're going to talk about that. That's a very interesting Barrett's esophageal. That's a very interesting one. I'm just going to say, but obviously we're not really touching on that. Let's see what they finish this out with.
A specific trigger that it could wear itself out, that it is not a lifelong process for you as it can be for some people. We won't know except for over time. And we do have really excellent treatments for it now with some of the immune modulating medicines that you're taking. But I think the path of
today.
Good morning. Thank you so much for taking my call. I love the show. I've already learned so much, so thank you. Quick, easy question, sort of, about washing your face. So are there any of those portable?
This is the last thing we'll let since we know that Chantel needs to wash her face more regularly, and then we're going to finish it up today, guys. I really appreciate you spending the time and learning a little bit more about skin with me today.
Face wipes that are really any good for your skin, and also is using a washcloth too harsh and abrasive for face washing?
Oh, such great questions, Lori. The wipes, I think the wipes are good both as a pre-cleanse, or if you had a late night out and you're just too tired to really wash your face, it's better than nothing. So I think they have a very good role. I like the Garnier one, which is in the drugstore, and the Neutrogena one, which is also good. And in the beginning, just pat. Instead of rubbing and wiping, just pat, and then you can gently wipe off the makeup. But I think the problem is that people are so aggressive in how they...
Oh, that micellar, that Garnier micellar water, the bomb. But you very gentle. You see these folks when the girls are taking off the makeup, they're so aggressive to their skin. Their skin's young, so, you know, they're not seeing the damage that they could do to their skin over time by being so aggressive to their skin. Just aggressive. It's you know, you're actually going to make your skin look less well, and most of your skin, why it looks good, is because of what you eat. It's not, you could use all the expensive skincare products in the world, and if you don't have a good diet, it's going to show on your skin.
Is it? And then the second part, what was the second question to that one?
The washcloth.
Oh, the washcloth.
Is that?
Yeah.
Yes.
Actually, no, washcloths are better. You clean, I think, up to 6 or 10 times better with a washcloth than you do with your hands. So using a washcloth, but it should be a gentle washcloth. And then the other thing is you want to clean the periphery of the face too. People just clean kind of the central face, but they don't really get to in front of the ears and around the forehead line. So with a washcloth, you cover more of your face than you do just with your hands and the soap and water or the cleanser. So washcloths are better. You obviously want to wash them.
Thank you for joining. Thank you so much. All the way from Poland, joining the team. Thank you so much. We appreciate the support. And that's Junebug saying thank you. Now, I'm interested in that a little bit. She said about a gentle washcloth. You know, and face washing is so important. To just give that face clean. Like I said, sometimes I'm tired. I'll just use sometimes just the micellar water and put some moisturizer on. If I'm, you know, especially recently, I haven't felt great. But at least in the day, I'm definitely making sure. But I remember that was the one thing I would not ever do when I was younger, was go to sleep with makeup on. It was like the biggest no-no for me. I can remember times at college having had probably a drink too many maybe that night at a party, and having a boyfriend of mine hold me up at the sink so I could still wash my face before bed. I was obsessive about it.
In a while, and then make sure that they're not sitting there damp in the sink between washing.
Lori from Alabama, thank you for asking that question, because now I'm going to pat my face with those wipes instead of rubbing them. Thank you so much for calling. So we have to head into a quick break, but stay tuned as we have open phones coming up after we're back.
All right, guys, I'm going to finish that part right there. And then for all of you who are my new members today, I do want to thank you. So I'm going to bring up a quick little video just to explain the different things with the membership that you'll get. And it's not to try to do anything other than, you know, obviously share this with you. So let me make sure I can find it. I had it the other day. I tell you guys, maybe no, it's somewhere. Let me look at my downloads. Here we go. Is that the draft? Oh, yes, it's the draft. Okay. All right, guys. Oh, no, that was from my designer. Hold on. Oh, no, hold on. That's a draft. All right, hold on. Oh, I don't know how to stop this. Hold on, let me take it off. That was the draft. I have the original video somewhere. It's supposed to explain all my different memberships. Oh, hold on, let me remove this one. That's the draft. I know I have it somewhere. I may have to wait, guys. I thought I had it here. That's the draft. Have I only got the draft? All right. Hold on. Let me try one more place. And then not to take up people's time. Let me see. Can I see it from over here? Unfortunately, I seem to be somebody who loves to delete stuff. All right. I'm being hopeless. Let me try one more thing. I don't want to keep people's time, but I do want to thank everybody who has participated in the talk today. I am wild. I tell you, I just wanted to show everything that you guys get. Oh, and I still need to add a voiceover to this thing too. So I do apologize. But I did want to thank, and obviously you can see I actually worked with a graphic designer. I don't know if any of you who are members have been able to use any of the emojis yet. I do have 4 emojis, and hopefully you now have little badges showing up next to your names. And they're supposed to, I probably need to look on YouTube itself or Nightbot and not StreamYard. That's what I need to learn to do. Because it's got some stuff in there. Okay. Well, let me get over to here. I did want to share the video at least so you can see what you got. Get my video. I apologize, guys. I'm have all this stuff that came through, and I wanted to show the video because I have a video to share that explains everything. And so let me try to show that. I apologize. If you want to hit the likes, please hit the likes and subscribe. Was this it? No, I think it was something separate. Oh gosh. Well, I missing my stuff. Let me see. Oh my goodness, Ray. Okay. All right, guys. I don't know why I'm not finding stuff over here. Oh, I'm losing half my audience because I'm so lost. Okay. Okay. I don't know what happened to my video. I'm gonna have to figure this out because I got a whole video that I can't seem to find. So I need to try to find my video. Okay. I had it at some point, and it seems like, is this it? Oh, this said it was the draft though. Hold on. Hold on, that wasn't it. Hold on. This is it? Oh, here it is. Ah, found it. Okay. Oh, no. Okay. All right, guys. I feel like I can't find my stuff. And I feel embarrassed now because I was looking at this video 1,000 times yesterday, and now I can't see my video. So let me not take anybody else's time up because I'm lost in my sauce, unfortunately, at the moment, it seems. I had a video file that I wanted to share and show the it wasn't a draft though, it was the final presentation, and I can't seemingly find it. No. All right. I might have to go back to my yeah, let me yeah, next time, Rosebud. Absolutely. I'm so sorry, guys. I just looked at it the other day. I don't understand where it went. Wow. You know, I've got too much on the desktop over here. And I brought it up and I looked at it and I was trying to get it ready to upload. And yeah, so I wanted to thank you guys and show you what you're getting as part of the memberships. And I had a video that explained everything and shows all the badges, all the emojis, all the different stuff. Like, see, the thing is, I think she sent it to me like a Canva file at some point. and I opened it up, and I tend to delete stuff real fast. So I need to try to get back into Canva and figure out what's going on. So I'm not going to take up any more time. I need to find out where my video is. I do want to thank everybody who became a new member today. We had Weena Marie, Leah, we had Sapphire, we had also thank you from MK for the super chat, for Mrs. Muerta for the super chat, for Sapphire for the super sticker, Funny Girl for joining the community. MK became a community member. Thank you so much. Miss Michelle did, Miss Kathy did, and Miss Kim did. And then Kim sent a super sticker too. Thank you so much. I really appreciate it. And I'm going to make sure that I put out to you guys the video that I have. I want to thank Rosebud, Bella Italia, of course, for all the information in the chat. Miss Pat Ray being here, helping out. I know Angel of Glass came in. Angel of Glass was definitely here, and I saw her there. I know I saw Brooke A stopped in. There's Angel. There she is. Brooke A stopped in right at the beginning of the chat. So all the mods, thank you guys so much. Thank you for just Miss Eloise for being here, because I asked if she was able to come on in and, you know, be a resource here to the community. And I was looking at your diabetes video the other day. It was really good. And also, I know we're talking about things. So yeah, Bella's phone's dying. Am I missing out any of my mods? I hope not. I hope not. Anyway, thank you, everybody. I don't want to take up any more of your time. I've been here for nearly 3 hours. My voice is going. My dog wants to be walked. Night, night from the UK. Absolutely. Hope everybody is safe and doing well wherever they are. Remember, wash your hands. Oh, thank you. I love you guys. You got your phone on the charger. Thank you. Thank you. Oh, happy National Nurses Day. Is that today? Is it National Nurses Day today? Am I totally unaware nowadays? Oh my God. Is it National Nurses Week? Oh my goodness. It is. It's National Nurses Week. Let me share the screen real fast. So all my nurses here. Thank you, Belle. Tells you I haven't been back. I haven't been working in the healthcare system because I'm trying to take care of my nose. So yes, it is National Nurses Week. Nurses make a difference every day. Anytime, anywhere, as always, is the message from the Defense Health Agency as National Nurses Week is celebrated. And if you work for a healthcare system, usually what they do is they hang a big old banner that says, Happy National Nurses Week. And then they invite you to bring a potluck meal dish to the floor. That's how we get celebrated. We get to have a potluck. No, thank you, Pat Ray. Thank you. Oh, yes. And all the nurses who were here in the chat. I know we did have a nurse here earlier. Happy National Nurses Week. Yeah, I know. Thank you for the help to the community. Yeah, it's a potluck. Or they give us a pizza party, or they would do like, basically some type of meal that was not anything I would touch. They would always get like the barbecue people, you know, so they have like barbecue, mac and cheese, and collard greens. Okay, because we're in the South. And if they actually serve people stuff that was healthy to eat at the hospitals, they'd probably have a riot. And we're talking about the employees. So they'd always do like something super unhealthy or give you a free ice cream cone. It's like all the things I didn't care to have. Yes. So it's always great. So make sure if you do see a nurse this week and you're out and about, make sure you wish the nurses happy National Nurses Week. All right, guys. According, hi, good, yeah, hi. Oh, Oh, Heather, you just came in? Oh, well, girl, go enjoy Vegas. Why are you stopping in here? We're talking about skin disorders today. I love me some Vegas. I am not gonna lie. Las Vegas has been, I know it sounds terrible, but you go to Vegas for a reason. Okay, to play blackjack and to see some shows. Okay, you just go knowing what you're going to Vegas for. And I do love, you're having a blast. Oh, I bet. I want to know which hotel you're staying at. I do enjoy Vegas. All right, guys. I'm gonna let according to Heather, get back to her Vegas trip. I am jealous. Oh my goodness. I've had so many good trips to Vegas. I love Vegas. I'm not gonna lie. It's a long way from Virginia Beach, though. And I've been to Vegas, I want to say 3 or 4 times. I want to say maybe 3 times to Vegas, which is quite a lot considering I live in Virginia Beach. And I'm not close like they are in California. At the Mirage. Woo! You go, girl. You have fun over there. I've actually run that Vegas strip. I love Vegas. Okay. All right, guys. I've thanked everybody. I'm going to try to figure out what I did with my video. No, it's around here somewhere. But otherwise, don't forget to subscribe. Thank you to all my new members. Thank you for joining me. Hit the likes if you did have fun on this conversation today. Thank you to all the mods, and we'll see you on the next show. I have something planned. I'm going to be a lot more active this week.